Bore da bawb a chroeso I gyfarfod Bwrdd Iechyd Prifysgol Betsi Cadwaladr y mis Mawrth hwn. Croeso cynnes I bawb sydd yma yn Llandudno yn Fenyw Cymru, yn y neuadd. Croeso cynnes hefyd os ydych chi'n ymuno â ni ar-lein. Ni'n falch iawn bod chi wedi gallu ymuno â ni y bore yma ar gyfer ein cyfarfod. Mae gennym ni agenda go hir yn unol ar arfer y nifer o faterion pwysig I drafod. Mae gennym ni, wrth gwrs, gyfieithu. Mae croeso unrhyw un gyfrannu yn ôl I dewis iaith. Yr eitem gyntaf ar yr agenda ydy ymddiheuriadau am absenoldeb a chroeso. A dwi isio croesawu un y ddau o bobl. Fi'n croesawu Pam Fenger sydd yn y gynulleidfa sydd yma yn sylwebu neu yn mynychu cyfarfod heddiw, a mae Pam yn dechrau yn y swydd cyfarwydd wraig gorfforaethol y mis nesaf. Croeso cynnes I Pam fydd yn ymuno yn un buan. Dwi hefyd yn croesawu Paolo sydd yma I gyflwyno eitem yn y mesur arbennig. Nes ymlaen croeso cynnes I ti Paolo. Ac dwi'n falch iawn o groesawu dau aelod newydd o'r bwrdd, Chris a Billy, sydd wedi ymuno yn ddiweddar, a dwi am droi atyn nhw just iddyn nhw gyflwyno hunain. Felly, Chris, at y ti gyntaf.
Good morning. My name's Chris Field. I was appointed at the start of March. I'm a barrister by training. I live in St Asaph, and Betsi touches all areas of my life and my family's lives. So I'm excited to get stuck in and see what I can do to help.
Diolch yn fawr, Chris. Croeso cynnes I ti, Billy.
Good morning. I'm Billy Nichols. I am one of the RCN stewards with Betsi Cadwaladr. I've been working with the organisation since 2002 and with staff side as well since probably 2006.
Diolch yn fawr, Billy, and you are our trade union rep, of course, on the board, so that's great to have a full complement of independent and board members, so that's great news. Ymddeiriadau eraill, un mae Clebyd yn ymddiheurio ar y dechrau bydd hi'n ymuno ni bellach ymlaen. Dwi'n meddwl fod Mike Lafyn, aelod annibynnol ar y ffordd. Dwi'n gobeithio fydd o'n ymddangos nes ymlaen. Dwi'n siŵr, does na ddim rhagor ymddeiriadau dwi ddim yn meddwl. Unrhyw un isio datgan buddiant unrhyw eitem. Ac dyna ni ar y gair croeso cynnes I Mike. Unrhyw un eisiau datgan buddiant am unrhyw eitem sydd ar agenda hyn. Jane.
Yes, just under the corporate governance report, my term of office as chair of HPF is on the agenda.
Yeah. Diolch yn fawr. Jane, unrhyw un arall. Na, ymlaen felly i'r eitem nesaf. Cofnodion y cyfarfod ac yn haliwyd y mis Ionawr yn cyfarfod diwethaf yn yr ugain o Ionawr. Ydy pawb yn hapus I dderbyn y cofnodion fel rhaid coelio. Pawb yn hapus? Ia, diolch yn fawr iawn. A wedyn ymlaen yn ni felly at camau gweithredu. Action log. Is there anything in particular you want to draw attention to before I ask for any questions?
Diolch, Chair. There are 8 actions on the log. 2 are outstanding, but we have dates in the diary for PFIG to scrutinise and hopefully give assurance on the progress of those actions, and that's at the end of April. And there's one ongoing action which is related to aligning risks to performance and quality report, and that report will come with that information on in the May board. And then in addition to that, there was a note in the minutes of the last meeting regarding training for independent members on statistical process control that seems to have missed ourselves putting that on the action log. So I'll put that on the action log, Chair, and we'll follow through on the provision of that informal training for independent members.
Reit, diolch yn fawr iawn. Unrhyw sylwyd cwestiwn? Pawb yn hapus i dderbyn yr adroddiad yna, felly dwi'n siŵr. Ie, pawb, diolch yn fawr iawn. Yr eitem nesaf, felly, ydy eto eitem sefydlog stori'r claf, sy'n eitem bwysig ar ein agenda ym mhob cyfarfod, ac mae gennym ni tro hwn casgliad o brofiadau vascular, a dwi am droi, a dwi'n meddwl at Nick i gyflwyno'r eitem. I think you can give us the presentation, Nick, I think, and we do have the video as usual, don't we? Diolch yn iawn.
Yes, thank you, Chair. At this board, we've heard an awful lot over the last few years about the progress being made in vascular. Myself and many other colleagues around the table have also had the privilege of sitting down and listening and talking to those vascular families, their carers and their families. So perhaps without any further ado, Chair, we felt it was really important for this board to hear from those patients and from people who are users of the service to hear their viewpoints, and then perhaps I will follow up with a few brief comments afterwards.
Diolch yn iawn.
My vascular surgical experience. I've been with the vascular service for over 12 months and I found it to be a brilliant service. I had a AAA, which is an abdominal aortic aneurysm. I lived in Lancashire when they found it, and I think on the size scale it was measuring at around 4 point something. They said they wouldn't do anything until it was measuring at 5 point something. Staff assured me that they would monitor me every 6 months, which they did. Then COVID came and the monitoring stopped, and I then moved to North Wales. I had to go to the hospital here, Ysbyty Glan Clwyd, and the hospital found it had grown a lot as I'd not been in for 18 months, and so they arranged an operation quickly. I was sent to Ysbyty Gwynedd, Bangor, for tests, as they didn't know whether to do it or not, but they gave me breathing tests and said I was okay and that I could have the operation. I think they were more bothered about my age because I'm 80. I'm now fantastic and the service was superb. I had the operation on the 4th of March 2023. Staff explained everything to me. They were wonderful. They said I would go to ITU for maybe 3 or 4 days, and there were no beds on the vascular ward, so I had to stay in ITU longer, and they said I could go home after 6 or 7 days. I never made it to the ward, but it was brilliant. I felt well enough to go home. My partner has done a lot of care work previously, and so they said as long as she is at home to see to me, I could go home. I was fit enough, but I just didn't have much of an appetite. Last year, I went for a checkup with the vascular service. I thought they were going to sign me off, but they said they will see me again during 2024, and then hopefully sign me over to a doctor as long as everything is okay. You can't fault them at all, really. They are a lovely team who told me everything. They were excellent.
My vascular service experience. I've been under the vascular service for about 12 years. I have a vascular problem with my veins and blood flow. I have a checkup every 3 months at Ysbyty Glan Clwyd for a repeat scan at the vascular laboratory. They're very good in the clinic. They talk and explain everything properly with you. But when you get to the ward, sometimes you don't know who's looking after you. It can be difficult to get the right information when you need it. Different surgeons can be looking after you, and some don't talk through how they're going to look after you. At the ward, you expect the same level of information you get at the clinic, but this isn't always the case. I know it's hard with COVID hitting us, and staff are amazing. I think they can get pushed back themselves at times. During my last visit, I was in for over a week on Ward 3. I had a room on my own, right by the desk when you walk into the ward, but the TV didn't work. It felt quite lonely. I had to ring a bell to ask for tea or coffee, as sometimes staff didn't always come in and ask. The poor nurses were running around. Staff were good on the whole. They were trying their hardest, but they were very busy. I've had a letter recently for a checkup in 3 months. I felt hesitant as I spent such a long week being on my own last time. I felt weary. I could hear nurses chatting outside, then passing my room. Looking back, I think I did feel a bit isolated. The positives were that the ward was clean and the food was lovely. Nursing staff tried their best. They were very caring, trying to keep us all calm.
My dad's experience. I would like to talk about my dad's recent experience of his treatment and care on Ward 3 at Ysbyty Gran Clwyd. Our experience was a very positive one, and we wanted to share feedback with the hospital. I would like to thank the staff for their kind, professional, helpful and no-nonsense treatment of Dad. They really did do well at being honest, understanding, attentive and direct. There were several staff members whose actions stood out. They took their time to really look after Dad and checked routinely for pulses in his legs. Staff were good at giving a complete handover to their colleagues and provided us with reassurance. We felt they were attentive, friendly, kind, and went to great lengths to ensure patients were as settled and comfortable as they could be. Despite being busy, staff spent time chatting to those who had no visitors. They were a credit to the team. On one particular occasion, staff spent time reassuring and calming Dad down when the plan had been to discharge him, but he was unable to leave due to his medications not being ready. Staff hand-delivered Dad's prescription to the pharmacy and really did do a great job of being empathetic, and they explained just how busy things were. Dad has been supported by a diabetic specialist nurse who first met him at an outpatient appointment. He has built a good practitioner-patient rapport with him. The specialist nurse has given clear advice and realised that Dad's diabetes needed to be brought under control. He's been understanding, accommodating and very helpful, both during appointments and whilst Dad was on the ward. We would like to thank everybody involved in my dad's experience.
So at this board, I'd suggest we focus on the fragility, the quality issues, the difficulties in providing the service since centralisation in 2019. And whilst the state-of-the-art vascular hybrid theatre and all the facilities are important, I think for me, this story shows that the true importance is our staff, not just the vascular surgeons, but the way the staff work together, our specialised nurses, our therapists, our psychologists, the pharmacists. We don't as often perhaps think of the effectiveness of that team working and the way that they care for patients. The paper that accompanies the story, I hope gives some confidence that we are now, as well as focusing on the quality, on the outcomes, on the data, are making huge efforts to listen to our patients, to understand the patient's experience and ensure that we look at quality in the true sense of the word and that patient experience drives our further improvements in what is a service that has made improvement but still has a way to go. Thank you, Chair.
A diolch i'r sawl sydd wedi cyflwyno ei straeon. Mae hynny wedi bod yn ddefnyddiol iawn i ni glywed llais y glaf yn uniongyrchol neu teulu wrth gwrs bob amser yn werthfawr ac yn helpu ni ar ein siwrne wella fel mae Nick wedi dweud. Unrhyw sylwadau neu gwestiynau os gwelwch yn dda? Bertha, gynta.
Good morning, thank you. Yeah, Nick, I'd just like to ask about referrals, if there's referrals to the hub and referrals to the spoke, and if that's running smoothly and everyone knows, what the process is.
So I think some of the story highlighted that this is a network with Wrexham and Bangor hospitals and the hub in Glen Clwyd. So I think those processes are under close attention. Everybody should know. Does it always work smoothly and perfectly? No, no complex system ever does. But I think it's the way that machine works together to care for our patients that's very much at the front of people's minds now.
Rhywun arall yn gwestiwn neu sylw? Na. Felly, troi at Carol, Prif Weithredwr, unrhyw sylwadau, please, Carol.
Yeah, lovely. Thanks very much. So, thanks to Nick and to the teams, the patient experience teams, and other colleagues who brought forward those stories. And thanks in particular to the people who gave their time to share their experience with us. I was particularly interested in understanding the time frame. So people who've been in contact with us over the last 12 months, but people who've been in the service for 12 years. And I think that's really important. You know, this has been a controversial service for very clear reasons, you know, in the public domain, and important that we're able to look back and learn about the lessons of service change and reconfiguration. I think it's particularly important we talk about what hub and spoke really means. You know, this is a service across all of North Wales, and I thought Eartha's question was a really great question about how we're linking. And when I was in Bangor a few months ago, I was on one of the wards and just asking the same sort of question about how it links across. I think there are a couple of key things that came out of the story specifically, people being spending too long in the wrong part of the hospital and the pathway, so intensive care rather than the ward. And when I visited the Ward 3 in YGC, I heard from the clinical colleagues that often people leaving the pathway is a challenge. But I think this is a sense of a developing and improving service. We've had HOW reports. We've got some more reports due to come through. And I'm hoping, Chair, that we're able then to sort of take stock of everything that we have heard about vascular to understand the position that it's at, and the route forward. So these contributions from our patients will be central to how we continue to develop the service. So,
great, thanks very much. That's very useful, and to Nick as well. And I'm just wondering if you could outline for us the path from here on, and the role of the board and committees and so on in supporting and monitoring the progress, and how we see that developing over the coming months and years, maybe.
Yeah, great. And I'll ask Nick to just add, because I know we've had a number of discussions about this. So, as I said, there's been a number of external pieces of work, case note reviews, the network in Wales has reviewed. We've got another case note review taking place. The intention being to draw all of that together to have a wider discussion as a board about where we assess vascular services to be, and what the ongoing improvement plan will be. And when I look at colleagues who are on the quality committee in particular, the role that the quality committee can have in overseeing that progress. But Nick, please correct me if I got that wrong.
No, Carol, of course not. So there's two external assurance reviews that we will be making public in due course, holding the mirror up to ourselves as to what they're telling us about that, the ongoing fragility of that service. And then, whilst vascular is of course a clinical area of concern within our special measures framework, we are slowly, in terms of our governance and our leadership around it, putting it back into the normal way of managing and leading a service, not least because the staff themselves I think often have been quite bruised and battered at times by this long journey, and we should be recognising that actually, as we go closer to a normal service, that we should be providing normal governance around it.
Great, diolch yn fawr for that. And I'm just looking at members of the QSE in particular who will take that up and monitor the progress and ensure we have sight of all the developments and help support that work going forward. Really, really important. Diolch yn fawr iawn I chi. Pawb wedi cael bydd o'r eitem yna yn unol ar arfer. Gai ddiolch I bawb sydd wedi bod yn paratoi'r eitem yna. Mae'n dipyn o waith ddod â hwnna at ei gilydd mewn gwirionedd, ac diolch I bawb sydd wedi bod yn glwm hynny. Ymlaen i'r eitem nesa, eitem 1.6 ydy adroddiad y cadeirydd, ac dwi ddim am ddarllen ddim o'r manylion, ond dwi dim ond eisiau tynnu sylw at ddau beth. Na, 3 os gwelwch yn dda, yn y dull traddodiadol Cymreig, yn gyntaf, wrth gwrs, da ni wedi bod yng nghanol newidiadau Llywodraeth Cymru, mae gen i brif weinidog newydd, da ni'n falch iawn, dwi'n meddwl bod gennym ni yr un gweinidog iechyd sydd yn parhau yn y swydd, ac bydd hynny o gymorth i ni, dwi'n sicr o hynny. Mae gen i weinidog, dirprwy weinidog newydd hefyd yn Jean Bryant, ac mae gen i brif weinidog newydd, wrth gwrs, ac yn rhinwedd y swydd byddwn ni'n sgwennu at yr holl weinidogion yna'n gwahodd nhw yma i'r gogledd i ymweld â lle bynnag maen nhw'n dymuno mwyn parhau ar berthynas waith sydd gennym ni gyda Llywodraeth a'r gweinidogion. Da ni'n falch iawn o'r hyn maen nhw wedi gwneud yn ystod y flwyddyn dwytha, da ni'n edrych ymlaen parhau i weithio efo nhw. Rhywbeth arall dwi jyst eisiau tynnu sylw at, mae yna lot fawr o weithgaredd wedi bod o gwmpas ein dathliad, os dyna'r term, o 12 mis o fod mewn mesur arbennig. Dwi'n siŵr os dathliad ydy'r term, ond nodi falle 12 mis o mesur arbennig, ac mae hynny wedi bod yn garreg milltir pwysig i ni fel bwrdd, dwi'n meddwl. Nid mwyn tynnu sylw at ni'n hunain, ond yn hytrach i gael trafodaethau gyda partneriad, gyda aelodau staff a'r cyhoedd ynglyn â'r hyn da ni wedi cyflawni, a'r hyn da ni'n gobeithio cyflawni i'r dyfodol. Mae'r cyfarfodydd yna wedi bod yn fuddiol, dwi'n credu. Dwi wedi cael adborth adeiladol gan nifer y bobl sydd wedi croesawu o, a dwi'n meddwl sy'n tanlinellu yr angen i ni barhau ar drafodaeth barhaol yna gyda partneriaid a'r cyhoedd a'n staff ni yn ystod misoedd a'r blynyddoedd sydd i ddod. Dwi'n credu bod yna fydd mawr o rannu gwybodaeth gyda phobl, ond hefyd dysgu gan beth sydd gan bobl i ddeud wrthyn ni. Ac mae wedi bod yn fantais i ni ddefnyddio'r flwyddyn sydd wedi bod a nodi'r blwyddyn yna wrth cael yr holl sylwadau a'r drafodaethau sydd wedi digwydd. Felly dwi'n eisiau diolch i bawb sydd wedi bod yn helpu trefnu'r digwyddiadau yna. A dwi'n edrych at Helen a'i thîm hi yn benodol yn ddiolchgar iawn am y gwaith yna, ac edrych ymlaen at wneud mwy o'r gwaith yma i'r dyfodol. Ac yn ola gen i ydy wahanol bethau dwi'n cael y fraint o fynychu yn rhinwedd fy swydd. Dwi'n eisiau tanlinellu un yn ormodol, ond mi roedd yn bleser fynd i'r Odeon yn Wrecsam, ac o'n i heb bod i'r sinema sawl blwyddyn, ond oedd yna premier o ffilm dementia, ac mae rhaid i mi ddeud, ges i'n nghyffroi gan y ffilm, ac a theimlo yn falch iawn o'r tîm sydd wedi bod yn gweithio ar hynny, ac yn falch iawn o'r rhai oedd wedi bod yn cymeryd rhan yn y ffilm. Unigolion a theuluoedd sydd wedi cael effaith dementia yn eu bywydau nhw, a dysges i lawer iawn a dweud y gwir o'r ffilm yna. Oedd yna griw da iawn o bobl yna, ond oeddwn i'n teimlo mae hwnna'n adnodd. Os ydych chi ddim wedi cael cyfle i wylio'r ffilm eto, mae ar gael ar wahanol gyfryngau cymdeithasol a YouTube ac yn y blaen. Mae'n werth i wylio, ac mae wedi bod yn waith penny gamp, dwi'n meddwl, fel dwi'n dweud. Ges i'n hyffroi gan yr holl beth ac dysgu gan bobl o'i profiadau nhw a pethau oeddwn ni ddim yn ymwybodol ohonyn nhw o blaen. Felly diolch i'r tîm sydd wedi bod yn rhan o gynhyrchu'r ffilm ac o drefnu pob dim. Ac dych chi'n gwybod be, os wedi bod yn bosib, jyst dangos y ffilm mewn swyddfa rwle yn fysa yn un o'n safleoedd ni. Ond dwi'n credu oedd yn deud rhywbeth bod y ffilm yna yng nghanol cinema gyhoeddus yn Wrecsam ac yn gyfle i roi neges gyhoeddus allan hefyd, felly diolch i bawb. Dyna ddiwedd y droddiad i am yr wythnosau misoedd dwytha. Hapus i ateb unrhyw gwestiynau neu unrhyw sylw. Sgwelwch yna. Os nad oes, diolch yn iawn i chi cyflwyno'r adroddiad yna i chi nodi. Diolch yn iawn, a dwi am droi rwan at y droddiad a prif weithredwr Carol drosodd y hi.
Diolch yn fawr. Thanks very much, Chair. Yeah, my report is provided for noting also, and I hope it provides useful information, both in terms of some of the key matters I draw out that are in more detail on the agenda, but also in relation to the work that we have been doing on the inquiries. And only, I think 2 weeks ago, the inquiry of the COVID-19 inquiry Wales session was held in Cardiff. We are very keen to see the publications from the inquiry to ensure that we can take learning from that, and we've got a pretty good setup now in terms of the number of inquiries that are underway. So I'll give a little bit of an outline there. You'll see I've been out and about and enjoying learning more about the services, hearing from staff, talking with patients, and depending on the time of the day, their relatives as well, getting a lot out of that. But I also wanted to share the really actually extraordinary achievements of 2 of the teams that work in the Health Board have been nominated and shortlisted for a St David's Award. And I thought that was a significant achievement when I went through all of the awards. So I just wanted to sort of highlight that really in case anyone had not picked that up. I also wanted to make a note about industrial action. We're in the longest period of industrial action during this week. It is clearly having an impact on the ability to provide the full range of services to our patients. And I know that from the executive team, the whole organisation wants to see a resolution to this as swiftly as possible. But we continue to work very constructively with colleagues in being able to respond to that. And then just finally wanted to indicate the work and the meetings with partners. There are many more that I could be outlining, but of the real enthusiasm for working with the Health Board in developing a number of joint initiatives, and we've got people coming up on the Royal Alex, for example, but there are a number of other developments we'll be looking at in the board over the coming months, so a lot to look forward to. So I'll leave it there, Chair, as there's a lot on the agenda today that we will cover.
Diolch yn fawr, Carol. Unrhyw sylw neu gwestiwn? Rwy'n sgwrs yna. Dyled?
Diolch. Dwi jyst isio ategu be oedd Carol gyfeirio at y fan'na, sef y gwasanaeth arena a'r enwebiad ar gyfer gwobr Dewi Sant. Mae hwnna'n dangos cydweithio da rhwng y Bwrdd Iechyd ag awdurdodau lleol. Gyda cynnwys Sir Ynys Môn, fel mae'n digwydd yn yr achos yma, ond mae hwnna'n rhywbeth positif iawn. A da ni'n dymuno'n dda iddyn nhw.
Mike?
Yeah, I'd just like to add a little aside really to what Carol was saying about the renal unit. A couple of weeks ago, there were the renal units were in reception in Ysbyty Gwynedd, giving advice out. And so I asked them, if you had a magic wand, what would you do? And they said they would like to see more testing at primary care level which would mean that these people that are in now wouldn't be in the renal unit. So maybe that's something we can look at in the future.
Could I just respond? You know, thanks ever so much, Mike. I should probably declare I'm a renal nurse by background, so I was quite enjoying myself when I went on the visit, and actually how much renal services have changed. But there is more to do to pick up early signs of disease to be able to tackle that. I'm so glad you asked the magic wand question. I asked this question, and I asked it when I was out and about at the postural mobility service just earlier in the week. I said, now, if you had a magic wand, and the person said, oh, just wait a minute there, Carol, went off to the office and came back with a magic wand. So I thought, you know, you've given me a chance to say that. But I think just asking that question helps us to understand from the staff's point of view, what is it that they would take forward if they could? Now, often in my experience, the answers aren't, you know, they're not, you know, something that is often unachievable. Often they're very, you know, practical things. So it's a great question, Mike, and thanks for the contribution.
Remember the experience we had in the mail or in the ED, and we asked similar questions, and they said, please give us an iPad, you know. So it's not sometimes rocket science what we think, but it's what from people's experience delivering services. It's something that is tangible and it should be within reach as well. So it's always a good question to ask. But be careful in the context you ask it, I would say as well. So diolch yn iawn Carol, a gawn ni hefyd ddiolch I Carol am yr holl waith mae'n gwneud. Dwi'n gwybod mae'n prysur iawn ac yn edrych ymlaen at benwythnos y Pasg gael chydig bach o seibiant, dwi'n siŵr. Felly diolch yn iawn Carol. Pawb yn hapus I dderbyn y adroddiad yna? Diolch I chi. Nawn ni droi eitem nesa 1.8 ydy adroddiad yr is-gadeirydd. Gareth, dros at y ti.
Diolch, Cadeirydd. I don't want to speak long to this. The main purpose of this report is so that I can be transparent about what I'm doing. But I will pick up actually on what Mike said, because I had a very interesting meeting with the senior leadership team across primary care, drawn from across the IHCs. And they are a really fantastic group of people, but they feel, and I know this is feels quite common, that primary care is not sufficiently focused on by this group. And I think while I don't want to see primary care primarily through the lens of secondary care, I think a bit like Mike said, it is true that if you want to solve some of the problems we have in our DGHs, we need to do that by getting even better at what we do in primary care. And I had a similar experience, so I think I may have said this to some of you before, but visiting one of the acute mental health wards, and when I said the same thing, well, what's your biggest problem that you can't solve? I said, actually, it's nothing to do with us here. It's the community mental health team, that they are so overwhelmed. So, you know, it is part of my role. I continue to do it, but I do think there's lots of excellent work being done in primary care, but we have a lot that we can do to better utilise our assets in both primary and community care. And I'm I know Carol is as well, that she's very committed to this, but you know, I determined as part of my role to make sure that we drive that work forward. But I'm happy to answer questions on anything that I put in the report.
Diolch yn iawn, Gareth, and that's a point well made, and I think we have an opportunity to discuss that a little more when we look at the plan and our future work, and that salient point is really, really important. Unrhyw gwestiynau sylw I Gareth os yn dda? Os nad oes gael ni dderbyn droddiad gai hefyd diolch galon I Gareth am ei gwaith yn swydd yr is-gadeirydd. Mae o'n brysur iawn, mae o'n mynd o gwmpas I gyfarfod lot fawr o bobl ac yn gwrando ac yn ceisio gwneud pob dim I gefnogi ac I ddylanwadu. Ddiolchgar iawn iddo fo am ei ymroddiad. Ar hynny hefyd, gai fanteisio ar y cyfle I ddiolch I holl aelodau o'r bwrdd am y gwaith maen nhw wedi cyflawni, a'n arbennig aelodau annibynnol os gawn ni ysgwach yn dda sydd yn mynd tu hwnt i'r hyn sydd mewn unrhyw gytundeb neu oriau gwaith ac sy'n hynod o weithgar ac yn gefnogi'r gwaith ym mhob ffordd bosib. A rwan mae gennym ni aelodaeth gyflawn o aelodau annibynnol bydd y gwaith yna yn parhau gyda'r un arddeliad dwi'n sicrhau. Ond diolch galon i bawb am ei gwaith. Mae'r bwrdd a'r bwrdd iechyd yn gyffredinol ddiolchgar iawn i chi yn bopeth ydych chi'n neud. Diolch. Ymlaen â ni i'r eitem nesaf, felly eitem 2.1 os ydy figurau yn iawn gen i. A'r eitem sefydlog ar y rhaglen wrth gwrs ydy mesur arbennig a diweddariad ar mesur arbennig ac so Paulo at y bwrdd yn ffurfiol fel petai. Dwi'n droi at Chris i gychwyn. Dwi'n meddwl, Chris, this is your item to kick us off, please. Diolch.
So thank you, Chair. As has already been discussed this morning, we are there or thereabouts at the 12-month period of being in special measures, and we have regularly brought to the board updates in terms of the work that has been undertaken and our continued learning in both how we approach arranging that work and also the outcomes from that work. Much of the credit for that work needs to go to Paolo, who diligently runs the programme within my team. So I'm going to, if it's okay, hand straight over to Paolo to take us through this paper.
Thanks, Chris. Paolo.
Diolch Chris. Bod ar bawb, dwi'n Paul Tardwell, cyfarwyddwr trawsnewid a golliant, a dwi'n mynd i siarad i chi trwy beth sydd wedi bod digwydd efo mesurau arbennig dros y blwyddyn diwetha. There's a comprehensive report in the papers which continues to link through to an in-depth closure report for the most recent 90-day cycles. So I'll just draw out a few key points in the main sections and also be supported by a number of members of the executive team to cover areas that they're involved in. So as Chris mentioned, we were placed into special measures just over a year ago, 27th of February. And after a 3-month period of discovery, we commenced our response plan from June 2023, embarking on 3 90-day cycles in order to drive focus and pace. The report, I hope, demonstrates quite a large amount of progress that's been made in a lot of foundational areas, but it is fair to say there's a lot more to do, particularly improving things for our patients and for the people of North Wales. We were supported by Welsh Government with specialist independent advisors who conducted a set of independent reviews to provide and inform our plans. All the independent reviews have now concluded with reports progressing through our internal governance, ultimately being published with their associated action plans. We're tracking those action plans, as you can see in the reports, through to conclusion, and the main themes that have come from those reviews are being paired with the relevant and most appropriate executive-led governance to ensure that we apply the learning across the organisation, not just in the area that the report was focused. So in terms of the progress of the last 9 months, we've taken an outcome-focused approach, grouping our plans into 5 main outcomes, which I'll step through now, bringing my colleagues in to draw out some of the key progress made in each of those areas. It's worth noting that this third 90-day cycle that finished at the end of February had our highest completion rate in terms of milestones completion at 70%, which is still not as high as we'd like. There are a number of areas that are outside of our control, but we continue to take the learning to make sure that we improve on our delivery going forward. The first of the 5 outcomes is outcome number 1, which is all around a well-functioning board. And this is all about ensuring that we're addressing the feedback from the Audit Wales board effectiveness review a year ago. And we've had a more recent re-review of that, but also a review into the Office of the Board Secretary, which, Phil, you may want to draw a few things out of in terms of key progress made.
Yeah, no, thanks very much, Paolo, the Chair. So yeah, there was over 100 recommendations in the independent review at the Office of the Board Secretary. So as Paolo said, 70% of those we've addressed, and that's led to all the board committees and the advisory groups being re-established. and operating under a refreshed terms of reference and forward work plans that were received by the board at the last meeting. So really grateful to colleagues for all your support. We were involved, that was a team. Thank you for that. David's already mentioned the recruitment of the team, you know, the full board. That's been a real collaborative effort with Welsh Government as well as with David and colleagues around the table. Much more to do, Paolo, and as I'm sure you know, we kind of want to be clear about, and it's really good to see Pam here today, the Director of Corporate Governance, and as an example of that, more to do, recruitment of the executive leadership group and team, and you know, focusing on some of the recommendations that are in the board effectiveness report that's been released and is in the public session later. Thank you, Paolo.
Thanks, Phil. So good progress there, and the earlier independent reviews to demonstrate a large number of the actions being completed. Outcome number 2 is all around creating a clear and deliverable plan. This was focused on the plan, the annual plan for 23-24 and the 3-year plan for 24 to 2027. And it covered both the planning arena as well as the financial aspects. I'll not come to Chris on the planning side of things because there's an item on the agenda later on which you'll enjoy on the 3-year plan. So if I bring Russ in to talk about some of the financial aspects.
Yeah, Dirk, thank you. So really just to give an oversight of some of the work that's happened and some of the progress we need to continue with, of course. So in terms of control and oversight, we endorsed a performance framework, of course, which is really important for us to embed throughout the organisation, just to understand performance and efficiency and productivity and enhancement as we move forwards. We also signed off a new standing financial instructions, standing orders, scheme of delegation and reservation. All of those give a business framework for how we wish to conduct our matters as we go forward. And again, that's really strengthened in terms of control environment. And the report itself alludes to the contracting and procurement review that was undertaken effectively in collaboration with Welsh Government, but also supported as we go through NHS shared services as well, NHS Wales shared services. Some of the training and delivery around all of that. So we've actually trained 400 managers within our departments around how we operate within our procurement rules and how we manage procurement and contracting as we go forwards. Still lots of work to do. A number of recommendations have been concluded, but still some to be completed as we go forward, of course. And some of the green shoots, so the savings, performance deliveries, are real evidence that people have moved on the agenda. And this year, that's really supported our delivery of financial outturn. Clearly, as we look forward, the financial climate is going to still remain very challenging, and we need to keep a focus on ensuring value and sustainability as we go forwards. We've endorsed a new approach to how we deliver savings and model savings delivery as we go forward. And I think that will be really important for us to align back to that performance framework and get that visibility and oversight as we progress. Thank you, Paolo.
Thank you, Russell. And one of the other bits that is yet to be delivered that we're going to be focusing on is the planning review, which we received later than expected. We have moved very quickly on that, and it will be coming through our internal governance, and we formed a draft action plan already. So we're going to be progressing that. On to outcome 3, strong leadership and engagement. This is all around making sure that not just leadership engagement is in focus for the organisation, but also the underpinning culture. This is one of our longer term and really fundamental blocks to get right, and it's all the way from board to board. I'd like to invite Jason to call out a few things, first of all, in his space in terms of progress made.
Thank you, Paolo. So a number of months ago, the board made its strategic intent really clear that we wanted to be a much more compassionate organisation. We wanted to make sure that our workforce are engaged, that we have really strong and clear visible leadership. And what's happened over the past few months is we've been putting the architecture in to support that. So as an organisation, we've now got a people and culture committee, which is chaired by the chair of the organisation to demonstrate a clear intent. And also as well, we have an organisational development steering group, which is chaired by Chief Executive, which demonstrates and helps drive all of the work that we have within this space. Some of the real positive points have been noted within Carol's review, really, which had noted that we had a big event across the organisation where Sir Michael West attended and Henry Engelhard from Admiral start to start the debate across the organisation about what organisation do we want to be, both for our patients, but also as well for our near 21,000 staff across the whole of North Wales. I think what's really important within this is that we know that we've got work to do, and we want to make sure that it's designed well, and we take people with us through that journey. So the People and Culture Committee will be key in driving the plans as we go forward, but also as well to make sure that the board has visibility of the work that we still have in place. We'll shortly have our integrated leadership development framework, and that will underpin our system around supporting leaders and managers to be good people managers, so we can be really clear with the expectations and give people the skills to do that. But also as well, one of the things that I'm proud of as well is the fact that as an organisation, we had really good engagement for our staff survey. We know there's work to do in that, but in terms of the engagement score for the organisation, the All Wales average was 73%, Betsi was at 72%, and that also compared to a number of other large health boards placed us ahead of a number of other organisations within Wales. So I think some of the feedback is that we're starting to get some positive responses in terms of our engagement, and also hopefully we can see that as well in other factors such as labour turnover as well with the reduction. So some significant work started, commitments made, but we recognise that this is a long-term piece to fully ensure that we're a really clear and compassionate organisation, and we're an employer's choice.
Just to notify me, Paolo, Jason referenced the chair of the Culture Committee. I've transferred the reins to another director. It doesn't have to be a director, but as it happens. And one of the reasons a chair of a health board cannot chair a committee, otherwise our colleagues from internal audit and Audit Wales will be writing to us quick. So just to explain that.
Thank you, Jason. You mentioned engagement a couple of times there with our staff survey. Internal and external engagement is a really core part of our plans, and Helen was wanting to add a couple of words in that space.
Paolo, just to say really that we now have very much an outward focus as an organisation. The theory is that we will go to where people are at. That very much started with the AGM last year when we were in Llandudno in a community centre, and we've been holding sessions with the public since then. And there is a programme for the year ahead that's in development as well. Also, openness and transparency, I think, forms very much a part of where we are. And for the 1 year on, marking that moment, we held briefings with staff, with the public, with stakeholders, and had a very thorough campaign that ensured we engaged as best as we could with our communities. Going forward, we have many things on the agenda, but the one I would pull out is a cross-section of Betsi Cadwaladr, lots of experts, people with some excellent skills and expertise in engagement coming together to work on our approach to engagement and what that will look like. It's very much a bottom-up approach, and very soon we'll be working with communities, patients, families and carers to co-produce what that looks like. Thanks, Paolo.
One area that we're going to apply some more focus on, building on the work that we've done already, is in the operating model space. That's a really key piece of work for us as an organisation, making sure that everyone is clear on accountability and how things need to work across such a large organisation. So I just wanted to signal that that's in the more to do space. Outcome 4 is all around improved access, outcomes and experience. This is the big hitting one in terms of where we make a difference for our patients and the public. And I'd invite Nick to say a few points in terms of key progress made.
Thank you, Paolo. And as you say, this is perhaps the outcome that's most visible to patients attending our emergency departments or waiting on waiting lists. As such, it has been really important for us, too many staff to mention, involved in delivering this on a day-by-day basis. But perhaps we'll particularly want to highlight Adele Gitto's work as Executive Director of Operations, who is currently on leave before moving on to pastures new, so is not with us today. And there are huge challenges left for us, and perhaps in other parts of this meeting today we may focus on some of those challenges. but perhaps we should highlight that there has been a 63% reduction in people waiting over 156 weeks. Of course, that does leave many people still waiting huge lengths of time, and our hearts go out to those people, and we are working on a day-by-day basis to do something about that. And that, for me, is doing things differently. The report highlights that having listened to patients and their views, now instead of not always offering routine outpatients after surgery, we have patient-initiated follow-up, so we can see the patients who need to be seen, allowing us to see other patients more quickly than we might otherwise have done. And in areas like dermatology, where there are waiting lists that really concern us, at the same time, we are finding new ways of working. And as we speak, almost live is a new teledermatoscopy service, so that patients will have to travel less far, and the images of their skin lesions can be seen more quickly, and they can receive either reassurance or treatment in a more timely fashion. In orthopaedics, the report highlights our enthusiasm about the Welsh Government's support for the Llandudno Hospital, and our ability to create a cold site. We're going throughout the year, even during winter pressures. But as well as that huge opportunity, our orthopaedic teams working in innovative ways, using treatment rooms when theatres aren't available to do procedures, and using their skills as far as we possibly can throughout the year. Also in the report highlighting the many reviews that have taken place that we've already touched on, and progress in vascular. So thank you, Pam.
Thanks, Nick. And this is a really difficult outcome to strike the right balance on, as Nick alluded to. We've clearly made a lot of progress, but a lot of the positions are not at all where we'd like them to be, and we will continue to press forward to improve those over the coming year. And as part of that, our endeavour with what we're calling challenged services is trying to move from people come in and tell us which are our challenge services. We must be able to identify those things ourselves, triangulating across a number of sources of insight and proactively getting on the front foot to identify, support and improve those services, which is all what Outcome 5 is about, which is a learning and self-improving organisation. Angela, if you could say a few points of key progress, please.
Yeah. So we identified when we received the patient safety report what we needed to do around embedding that information that came to us and actually learning from it. So we developed an action plan immediately on the back of that, and we're on track to develop it. As part of the objective, though, we tried to look wider than that. So as Carol highlighted in her report, we're currently developing a policy management system for Betsi, and we are going to be having a framework presented at May board, and discussions with colleagues across the organisation are ongoing. We've been working externally and with NHS Executive, IHI and Improvement Cymru to make sure we've got the best bit for Betsi, and it isn't something off the shelf we're bringing in. It's got to be about Betsi, about culture, about how we can take it forward. We're doing significant work around our electronic health record, and a business case proposal has been developed. For us to have that, it's been given back to us in lots of arenas that we need that to make sure that we are sustainable, that we're communicating, that we are learning from what's happening across the organisation. And Dylan's team have been really key in supporting us from a clinical exec point of view to make sure it's where it needs to be taken forward. We've looked at our healthcare public health programme proposal, and we've agreed diabetes is where we want to focus and where we want to take forward. So that has now been approved. And we're looking at transformation improvement resources across the organisation, actually with the clinicians at the front line, with the teams, to ensure that they can deliver the changes that they see and they can actually provide that information. So a learning organisation framework is in development. It's been developed by the teams on the ground. We've got organisation learning forum that is really established now and has been commended by NHS Executive for the work that we've been doing. We now need to scale that up and spread it across the organisation as part of the policy management system. And currently we're looking at an investigation and learning programme. So reviewing our investigations that are historic, that have still got to go through process, and making sure that they're as robust as we can make them and what the learning is from them that we can take forward. We're improving the quality of our investigation and the reports that are going out to the coroner and to the public families and to patients, to make sure that we're being very open and honest about what's happened, how we're going to improve from it, and then collecting those themes and making sure that we're not repeating those mistakes as we go across. So there's a lot of work in this arena, and the teams are very fired up by making sure that we are learning from everything that we're doing, not just the crises, the incidents that potentially happen, but the good work that has happened so that we can cascade it across the organisation.
Angela. So there's been a huge amount of learning over the last year as we've started to stabilise a number of the key areas, and one of the biggest items that we need to plan is to get a longer time horizon view of the work that we're looking to do. So looking ahead, the 5 special measures outcomes have been broadened to be the basis of the organisation of 5 strategic objectives within the 3-year plan and delivery plans. The report gives a view of how some of those areas from special measures have been incorporated into the 3-year plan, and indeed in the item later on you'll hear more about that. But I wanted to reassure that actually you'll be hearing less about special measures as a other term as it becomes more mainstream and onboarded with our overarching and more holistic annual delivery planning approach. So just to finish off and summarise, I think it's fair to say there's been a huge amount of progress made, lots of foundational work that has created the conditions we need for future improvement. I'd like to thank all those across the organisation, our partners in Welsh Government who have helped us to get to where we are today, and of course the board in your continued support and encouragement in building an effective, strong organisation for the long term. So diolch yn fawr, na i cymryd unrhyw cwestiwn.
Chris, do you want to add anything? No. Okay. So can you, lots of bobl eisiau cwestiwn? Gawn ni ddiolch I Paolo am y cyflwyniad a'r gwaith ardderchog digwydd y diolch I ti a'r gwaith arbennig o dda. Reit, cwestiynau. Yn gen I Fôn gynta, wedyn Wrtha, Gareth yn y drefn yna.
Ie, diolch. Sa'n gwybod siarad ddechrau fo, dwi'n meddwl bod o'n hawdd iawn I fynd fel 41 aelod o staff dros dro I 2. Dwi'n meddwl bod hwnna'n gams gyda hwnna, mae'r chwarae bach mor fath o'n digwydd. Dwi'n meddwl bod o'n Williams yn yno. Ella'r cwestiwn i'r sylw ydy, ddech chi'n newid glod yn Angela ynglyn â'r diwylliant o ddysgu. Felly, yda ni rwan yn gwneud yn siŵr bod yna bobl lleol, bobl sydd o fewn bwrdd iechyd o Betsi erbyn iddyn cael y cyfleoedd yma. A hefyd, pa sicrwydd ydyn ni gael bod ni ddim yn mynd I fynd yn ôl i'r default position os ydych chi o mynd I ddefnyddio staff dros dro, I lle bod ni'n edrych ar ein cyfleoedd I bobl camu fyny, ella dros dro o fi fewn.
Cwestiwn da iawn ynglyn â tyfu'r gweithlu cyfleoedd I bobl a draws Gogledd Cymru. Dwi'n siŵr os ydych chi'n eisiau ateb hwnna, dwi'n sbio Paolo neu sbio ar Jason, neu sbio ar Chris, neu sbio ar Angela. Gabawb rhywbeth ydy. But no, maybe Chris, do you want to field that one to begin with?
So I think that's a fantastic observation, and you'll see when we move a little bit further on into the 3-year plan that exactly that point is drawn out. It's important for the organisation that we recognise our role as an anchor organisation and as the biggest employer in the area, and the role that has both in terms of developing our workforce, the importance that has for those individuals, but also for their families and their communities. So we make reference to that both in the workforce section in the 3-year plan, but also in other sections, recognising how important it is not to get back into the place you reference for.
And an opportunity for people to have a career, not just a job, but a career. And that's speaking to students sometimes both in Wrexham and Bangor, and that's one of the points I make. It's about the opportunity to have a career and develop your skills over a period. So really important point. Diolch yn fawr. Wrtha nesa wedyn Gareth.
Yeah, thank you. I just wondered if you could explain a little bit more around when we might learn more about the operating model, because obviously that's going to be key for all of us in understanding roles, responsibilities, relationships, in delivering this excellent healthcare that's the goal for all of us. So could you just explain a bit more about where we are with that?
I'll give you an answer, but I can see someone over there.
We've got this signal going. I'll pick that up. So we've got a lot to do as an organisation, and although we're reviewing where we are 1 year in, we've got to be honest and open to say there's a very long way to go before we're a really effective organisation. But we need to help people to be able to deliver the roles that they've got and deliver the work that we need to do. I've had a lot of feedback since I've been here, which is not that far off a year now, about the operating model. It's the structure, it's how the organisation works. So a couple of key pieces of work are underway, including internal audit, shared services work, and I've got the draft report in now. The next phase over the next 6 weeks or so is to draw in some other insights and to start to draw the conclusions about what's working well, what's not working well, and people's thoughts about the future. And then we will go across the organisation, having conversations about what modifications that we could make. Very important that we're not further disrupting structures in the organisation where we don't need to. So we need to be proportionate here. But from the feedback I've had, we need to make some changes. But we're drawing in a few more views on that. So within Q1 of this coming financial year, a lot of work, supported by workforce and organisational development function as well.
Diolch yn fawr. Gareth, nesa wedyn Angela.
Sort of less question than a comment, and for really I wanted to commend the work that's been done on this, because I think the format and the tone of this report is exactly right. I think it's a board, we're really committed to being transparent, and I think getting the balance right between talking about what we've achieved and recognising that's that in the context of we've still got an awful lot of work to do. And I think by and large this report really gets it right, and that ties in with what we heard about the special measures and the meetings that we had to the 12-month review. Yeah. So that's really good, and I think in terms of that transparency, and perhaps thinking about the story on the BBC today, we took a very conscious decision as a board that we would embrace risk when it came to reputation, that it's more important to be honest with people, even if that gets us bad publicity, than it is to try and sweep things under the carpet. So I just want to really commend that and emphasise that. Having said that, there's always a problem getting the balance right, and I was really pleased to hear Nick's comments, because with plan care, for example, how do we say we obviously have made progress, but from a common sense point of view, if all you're saying is we've got rid of 5-year wage, then people are going to say, So, I think we all know that, but just that's an example, isn't it? I will want to talk later when we come on to the quality report a bit more about this, but I just want to say how absolutely fundamental the issues around culture and how we treat, how we deal with things when they've gone wrong is. And this is linked to the mental health review stock take as well, because as I see it, there are 3 things in there. And I do want to say that I think mental health gets a bad rap. I think a lot of our staff are doing a fantastic job. But there are 3 elements that really comes down to. One is the lack of electronic records. And we are addressing that, but it's a medium term, long term before, you can't do anything about it overnight. No. There's questions about the estate, which is extremely challenging in terms of financial environment and timescales. And the third thing is about culture, when I'm not singling out mental health, but it's about how we respond when things go wrong. And that is something, I know it's culture change is also a long term, but I think we can do something about that in the shorter term. So we really need to think about that. And the final point I wanted to make is perhaps a slightly more positive one, but it's difficult because it all fits into this same, how do we say, yes, we have made progress while recognising the broader picture. But I do think the thing about urgent and emergency care and the weights, there's quite a lot of, I think, perhaps I'm wrong, but misconception is, people having to wait for 12, 24 hours. Obviously, that's unacceptable. But I think that's often thought, people often think that's, and nobody's paying any attention to them. So I think that 11-minute figure about actually somebody with the skills to know what is wrong, having an initial. And we just need to make that clear, that not saying in any way that the situation in our emergency departments is satisfactory, but that please don't think that people are just being parked there and ignored, because that's not what we're doing. It's the problem is further down this James. So that's probably some more than enough for me. But thank you. But thanks very much to Paola and to the team, because I think this is exactly the right approach.
Angela.
Thank you. It was actually to come back on Vaughan's point about the interims and the temporary staffing. So obviously nursing and midwifery is a large proportion of the workforce, and we're doing a lot of work at the moment around retention and recruitment, and making sure that the flexibility we can offer will encourage people to work for us. There are a few areas within Betsi at the moment where we're actually not going to be able to use agency because we're not going to have any vacancies. So we're having conversations with agency and bank staff currently to say, we're not going to have the work available for you. There are vacancies coming up. Would you like to apply for them and come and join us and have those conversations with our agency staff and bank staff who've worked for us for a long time? So we've done it because of the flexibility it offers, and allow them to come in and have a talk to us about work-life balance. I've got a couple of examples of staff who've spoken to me are now permanent within Betsi and are actually benefiting from being part of the Betsi family rather than coming into the organisation on an interim basis.
It's a really good point, and it's an example of where people's ask in terms of employment now is different to what it's different to what it was 3 years ago, certainly different to what it was 25 years ago. And we've got to make sure we then engage with our staff and potential staff, and we change where we can in order to accommodate them, rather than sometimes we expect everybody to go along with what we are offering. We've got to try and be flexible where it's possible. It's not possible with everything, but where it is, I think that's really good news. Unrhyw arall yn y gwestiwn neu sylw, just un, Dylan?
Yeah, un sylw, just one sylw, please. I think we're in a really good place, really. It's probably worth saying. And I think it's quite important that we also remember that the special measures thing tends to be a pressure on what we can do right now. We've got to recognise that we're in a bit of a twin track approach or split screen approach, where we do need to sort things out immediately now, but we've also got to think about a plan for the long term. This is a marathon, not a sprint, and it's just to make that point that we don't forget that. I'm picking up on the points on the operating model to some degree, as Carol's sort of saying, form follows function. So the operating model, how we make decisions, partners, etc. That's you just got to recognise that as well. I think.
Good point. So I'm going to throw in a challenge around this, because it's very much the focus of government, isn't it? Rightly so. We're in special measures for a reason. Very detailed reports. We have meetings on a regular basis with ministers. So when I walk around my community and other places and somebody stops me and has a deep conversation about the NHS, what should I say this is achieving then? Because for me, that will always be the litmus test, is what people in their communities and people who use our services, what difference is it making to them? So how do we feel about that? Where are we on that particular bit of the journey? It will be different for people depending where they are and what services they use. I know that, but is there a general conclusion we could come to, that this weekend when I meet lots of people in my area, I'll be able to say, when they ask me, what on earth are you doing? I'll be able to say, well, this is where we're at. That's the challenge that the public will give us, I think. So what's the answer, Carol?
Well, I was thinking about a football analogy, but it might be a bit soon on football. But and we've definitely moved on from rugby. So this is what I think. The organisation was spinning a year ago. There were, pretty dramatic changes made, and that has an impact on how an organisation can function. So our key focus has been, let's try and get an organisation that can function well, because when we've got an organisation that functions well, we're able to tackle the real issues that matter to people. So, if I see this as a continuum, and I like, Dylan's absolutely right, this is a twin track. We have to place a real focus on the immediacy. But if we're only in the immediacy, we're never building for the long term. But we've got to get enough space for that longer term. We're going to come to the plan. But if I was talking to people in your community, I would be saying, we're starting to get a stronger organisation, but we're starting to make some improvements to care, and there's lots of evidence of great care that goes on every single day, I should say.
Yeah.
But we know it's nowhere near good enough yet. But we are working, night and day to make the improvements that we need to make, and people will see that improvement coming through.
Yeah.
But it's not necessarily going to be overnight. So, there is something about expectations management here. This is about making change for the long term. So this organisation's stronger to take it into the future. When we come on to the 3-year plan, Chair, if that's all right, I think we can be clear about the action we're going to take and the result we want from that in this coming year. The focus on these challenged services, the focus on improving access, but fundamentally improving quality, will come through that item, or should come through that item. So I don't know if that will help you on Saturday afternoon as you're walking through your village, but
No.
I hope that's helpful.
And just to add to that, I did relay a story some months ago that somebody stopped me one afternoon at the weekend and really was quite upset about the delay to his treatment. He was on a waiting list and had been waiting a very long time and was in a great deal of pain. So a couple of months ago, I had a message from him to say he had his operation and it was absolutely fantastic. That was his words, excellent. He couldn't ask for better treatment than he received. And that, to me, is the crux of the whole thing. We know that for the vast majority of people, when they get the service, it is first class. We've heard people say that, haven't we, to us? People, Rolls Royce, people have described it. This person got a background in farming, so you can imagine his approach to things. He's very analytical, and he said it was first class, but it's the wait, and there lies the problem. That's not everything to do with our health service, but it's a major part for people. So that's the two sides of it, isn't it? It's the wait and people suffering whilst they're waiting, but when they get the service, it is first rate. So it's worth sort of reminding us about that, and the annual plan hopefully will help us progress further. But there has been good progress. We're in a good place to make further progress. That's what I will be sharing with people when you stop me. So diolch yn fawr. Unrhyw un arall isio holi unrhyw cwestiwn? Os nad oes, gai ofyn I chi dderbyn yr adroddiad yna a cael sicrwydd am y gwaith sydd wedi digwydd a'r cynnydd sydd wedi bod, a dyn ni'n edrych ymlaen at barhau gyda'r cynnydd, ac unwaith eto ga i ddiolch i Paolo yn arbennig am I waith, ffordd mae yn roi'r gwaith a'r holl dîm. Dyn ni'n ddiolchgar iawn am bopeth mae pawb yn wneud. Os ni wedi rannu hynny efo pawb, byddwn ni'n ddiolchgar iawn. Diolch yn iawn. Ymlaen â ni, os gwelwch yn dda i'r eitem nesa, eitem 2.2, adroddiad gan Archwilio Cymru a'r effeithiolrwydd yn ymateb ni fel bwrdd, ac dwi'n meddwl dyn ni wedi crybwyll yr adroddiad yma sawl gwaith yn y gorffennol, ond dyma fo heddiw yn llawn I weld ein hymateb ni i'r pwyntiau mae Archwilio Cymru wedi codi. Na I droi at Carol unwaith eto ar gyfer y adroddiad yma, please. Diolch, Carol.
Diolch. Thanks very much indeed. The report has been prepared asking the board to both note and consider the work of Audit Wales in their follow-up to the board effectiveness and to consider the health board response to this. So it certainly does link to the previous item that was presented. And the reason why these reports are so important is that these are external colleagues, professional audit colleagues taking a view with that independence of thought and mind. And so very grateful to Audit Wales for the work that they have undertaken and for bringing forward their report. It clearly is a report that is in the public interest and therefore was published with commentary from the Auditor General and clearly has been in the public domain, but important that we formally receive this report and discuss the Health Board response to the report. I think the big message is the board is improving. The relationships are improving and are more positive. The dysfunctionality that Audit Wales had described previously is no longer evident. However, there are some fundamental challenges that we have got to tackle and some really important opportunities that we can take. And the cover paper covers some of those, but of course the report in more detail outlines those. What we have done in terms of the findings and the responses to make sure, of course, that all of this is aligned into the 3-year plan. We're building up this plan, sorry, Chris. But, you know, the plan is the plan, you know, things go into that and you can see a coherence and then a focus on delivery. So that's where the recommendations will be placed and we'll be clearly following up on that. We have yet to consider with Audit Wales what happens next year. It is normal practice that the structured assessment of organisations considers board effectiveness. It's just because of the issues they were pulled out. So it may well be that it comes back in that form next year. The Audit Committee has a clear role here as well in ensuring that we're tracking through the recommendations in implementation. And so the follow-up audit tracking will take place through there as well. But I'm happy to take any comments, questions and suggestions, Chair. Thank you.
Diolch yn iawn, Carol. A diolch am yr adroddiad. Unrhyw sylw, unrhyw gwestiwn.
If no one else is going to say, perhaps I should just say that, you know, for purposes of the public, that we have had a detailed discussion of this last time of when we had the report before we did the response. So, yeah, I don't want people to attribute any silence to me that we're not interested or that we. I think it's a very sound report, and I think we're broadly happy with it. But I don't think we need to have a further discussion. But I want to be clear.
Yes, that's very. So we've had a detailed discussion with colleagues from Audit Wales, and we continue to work closely with them and have meetings, and they will be a key part and a key partner in our improvement journey, of course. So really good that we've had that report noting what has been achieved, and there's been some progress since that report actually has been published. So some of those matters have been noted. Time has moved on and further progress has been made. But yeah, pam hapus I dderbyn yr adroddiad. Felly everybody, yeah, diolch yn fawr iawn. Ymlaen i ni at yr eitem nesaf, felly eitem 2.3 ac yn ddyn tair blynedd. A mae hon yn eitem bwysig ac sylweddol I ni yn y cyfarfod yma. Felly mae'n gryn dipyn I ni drafod dwi'n siŵr. Mae'n droi at Chris, dwi'n meddwl, I gychwyn y drafodaeth ac agor os gwelwch yn dda. Chris, over to you to begin with.
Thank you, Chair. There's been some very helpful conversation already today that lines this item up well. We do have just a few slides to just take us through that Russ and Jason will help with. But just before I go into the slides, just for some assurance, I'm really grateful for the contributions of SRG and Partnership Forum and then PFIG Workshop in pulling together and testing the contributions of the plan. PFIG met last week to consider the version that has been published here in the pack. And you'll see in the cover note a number of relatively minor changes that were suggested at that committee. I just want to confirm firstly that all of those changes have been made. We will republish the final version after board today, reflecting that in any changes that come from this conversation. But just to be clear that those changes are already present. Since PFIG, we have finalised the integrated impact assessment, which is positive. Whilst you have the English language version of the plan in front of you, as we speak, the Welsh language version is being worked upon, as too is an easy read version, and both of those will be published alongside the final English version as soon as they are both available. Moving on then to the second slide, just gives us some brief overview in terms of the requirements for an IMTP. There is a statutory requirement, as colleagues are aware, upon the health board to produce a 3-year plan that improves the health of the population, the provision of healthcare, is balanced over a 3-year period and approvable by Welsh ministers. If an organisation is unable to produce an approvable plan, then there is an expectation that we produce an annual plan. I'm going to just take us 2 slides forwards. Thank you. As is a similar position with other health boards, we will be unable to submit an approvable 3-year IMTP this year. However, we're really clear that submitting a plan that is focused upon the next year, it's an annual plan, and only focused upon the next year would be the wrong thing to do. So we have created a 3-year plan which focuses particularly upon the next year, but within a very clear 3-year context. And that's for all of the reasons that we have just heard of in the special measures conversation, and then in the comments from Dylan and Carol since, in terms of just how important it is that we now lift our view and look further beyond the next year. That allows us to start thinking about the solutions that are further down line or for this organisation. That allows us to become sustainable and remain sustainable So that twin track approach is absolutely crucial for us as we move forwards. In terms of the content that you'll see within the plan, there's a strong focus upon improving operational performance. Clearly, we need to respond to the observations made that have led us to be in escalation with Welsh Government. And there is an important requirement that we respond to the national planning guidance, which includes the Minister's priorities. In fact, those three very significantly overlap. And so the plan is based upon all of those three, that overlapping space, and has content within there that looks forward, as I've said, but also reflects the important in-year changes coming forwards next year to help to improve that operational performance. It includes issues that we've already heard this morning in terms of how we work better with others, how we recognise our role as being the biggest employer in North Wales, and what further we should be contributing in that arena. There's been really strong support as we've gone out into the organisation and discussed with stakeholders that we structure this plan around the 5 special measure outcomes, and Paolo very helpfully showed how we've moved those into the 5 sections of the 3-year plan as we go forwards. Those 5 sections then are in terms of building an effective organisation, how we deliver strategy and long lasting change, how we focus upon creating a compassionate culture, our leadership and engagement, this section on improving quality outcomes and experience, and then how we establish ourselves as an effective environment for learning. I'm not going to go through all 41 of the sort of sections listed here, but you'll very clearly see from that the continuing impact of special measures through that. All of the continuing pieces of work Paolo outlined can be found within those 41 items on that slide. I'd perhaps draw out on objective 4, which is the objective about our quality outcomes and experience, some particular challenges. Every year we have challenge in terms of how to structure this element of our plan. Because breaking down different parts of our clinical services is always artificial. We talked a little bit about primary care. Primary care is not just about primary care, but it's about planned care, cancer care, urgent and emergency care. It crosses across all. And another area that I'd draw out, for example, would be dementia, because dementia covers all of those areas too. And dementia, for example, is really important in our set of objectives on strategy and long-lasting change. It's really important and is drawn out in our section on compassionate culture and engagement too, and how we think more appropriately about those individuals who have frailty or multiple conditions. The plan is an integrated plan, so we now have a couple of slides which Russ will take us through, and then a slide that Jason will take us through.
Yeah, dear Chris. I think I'll test members' eyesight trying to see that. I'll do my best.
Lots of red.
Yes, there is some red bars, absolutely. If I walk you through just very quickly how we developed the plan, and some of it will articulate our journey actually as well in the 23-24 financial year. So you can see initially we set a red bar at the far left, which was the £134 million deficit plan. That was part of the All Wales National Deficit Plan of 648 million. Since then, of course, we encountered some financial challenge, and we've put some control processes in place, as we've alluded to earlier, that brought that position back. We've used some balance sheet flexibility as well, which are effectively measures to control costs and bring in-year costs down, but it's not available going forwards. And then we received an allocation of income, 101 million from Welsh Government. All health boards received a proportional share of that resource. So we moved our position back to an outturn deficit plan of 33 million pounds. So that is the comparable figure with the 101 million pounds Welsh Government additional allocation to our original plan that we endorsed as a board. We then, in determining an underlying position as we start to move into the 24-25 financial year, we have to take off those one-off allocations that the health board has received for income. So Welsh Government allocations for performance and transformation, that was 82 million pounds, and 101 million that we've just discussed with regards to the allocation we received last year. Although elements of that can become conditional, it's conditionally recurrent, so can become recurrent. So apologies for that if that's confusing. It's a new terminology for myself as well. So we've moved to our position. So if we take out the income we've received one-off this year in 23-24 that we're not necessarily entitled to as a start position as we move into 24-25, our underlying deficit is circa 253 million pounds as a start point. And the two bullets there are really quite evident. So one is you can only use your balance sheet once, and we're using it in 23-24. And the second one is, of course, that we are still heavily reliant on those non-recurrent allocations, and therefore we need to make progress towards those control targets to secure them. Move to the next slide. So just in case the previous slide was challenging you, for those with exceptional eyesight, you'll see there's lots more little bridges. So essentially, we start on the left at 252 million. All of the green is additional income allocations that we have secured. So those two Welsh Government allocations are back in our position, the 82 million and the 101 element, 74.6 of it. And then we receive growth, which is great. So a lot of public sector bodies within the Wales community and Welsh Government have not received that growth allocation. So it was a really substantial deal that was done through Welsh Government for us. And then, of course, on top of that, we've got sustainability funds, which is elective recovery funds, specific funding recurrently in our baseline to support tackling long waits, selective care, as we've alluded to earlier. And then the bridge takes us back out with inflationary pressures, some costs and some specific income and specific costs. Where that leaves us is effectively a 2.8% savings target for the new year. That is a 48 million pounds target, so 25.2 this year. We managed to just achieve and slightly get beyond that. So to effectively, you have to do it again, but this time it's 48 million. The directive was to have a minimum of a 2% savings threshold, as is 2.8%. So that will be challenging. That will only be delivered through the value sustainability work, and that is a byproduct. So the value sustainability programme is all to enhance service provision. It is not about financials. It's using our money better. The financial benefits are a byproduct of using the resource better. So it's not cutting services, it's using that money more efficiently and effectively. And moving away from that premium working and using waiting list initiatives, etc., which are all high cost, out of hours, not the right things for our staff either. That still leaves us, though, even if we deliver that plan, a 19.7 million pounds deficit. That is akin to our control target deficit for this year, the 23-24 financial year. So we are still having a circa 20 million pounds deficit, 19.7. That means we will not be achieving, based on endorsement of this plan, the key financial duty to achieve break-even performance in year. We already know the second duty, which is a 3-year compliant term. So whilst we are potentially not on our own in terms of health boards and submissions of financial plans, that is clearly a difficult position for us to submit. And it's one we need to work on to have a sustainable financial model as we go forward. And really just to touch on the plan as we move into the future years, because this is not a 1 year, it's a 3 year model. We'll need to really embed that value sustainability work throughout that whole 3 years so that we can move to the position where we meet next year and we endorse a balanced plan and we endorse a compliant IMT medium term plan as well. Thank you, Chris.
Thanks.
Great, thank you. I think this slide notes the importance really as the large employer that we've got really good workforce planning in place. We recognise really that what we've done in the past, which might be think about roles in traditional ways and advertising for those roles, we need to think differently because those people aren't necessarily out there in the volumes that we may want to attract. So the plan recognises that we need to make sure that we've got a sustainable and a clear framework that follows the HEIW process. It's quite timely as well because as part of all of our reviews, we've had our Audit Wales review in relation to workforce planning, and that will make its way through the relevant audit committees. But that then provides a really clear framework for us to be able to identify what our central resource is, but also as well make sure that we've got a systematic approach. I think it's positive as well that we've started within nursing, and I know that Angela is undertaking reviews over the past 12 months in relation to establishment, and there are plans in place as well for the next 12 months. But the plan recognises as well that we need to build upon that because we need to be thinking about what are the other alternatives. For example, our apprentice strategy around attracting people. What are we doing in relation to our retention to the workforce? We've already made some significant strides through within the past 12 months. For example, you know, our Live Well, Work Well programme, which is trying to support staff physically, psychologically and financially through difficult times. But we recognise that we need to get to a point of being quite granular really around the numbers to make sure that finance and workforce numbers start to tie together really. But I think it's important that the workforce plan is testing out really whether or not our ability to attract is a real likelihood, or do we need to think fundamentally different around those alternative roles.
So just drawing to an end in terms of the presentation, it's important for us to provide some assurance in terms of the delivery of the plan. And you'll see next month we will have in place the delivery plan for year one. And the purpose of the delivery plan really is to convert this narrative document into a set of much smarter outcome focused measures against which we can monitor performance. That it's really important that we get that right, because if we don't get that right at the beginning of the year, we'll be coming back reporting that we've not managed to achieve things simply because we didn't spend another week or two just absolutely bottoming some of those items out with individuals across the organisation. So we will have that right so that we can work with it from the end of April. Alongside having a narrative plan, we're really clear in terms of how we cascade that through the organisation. The plan priorities will feature through in terms of our exec and senior leadership priorities, objectives, and will follow through in terms of leaders across the organisation, our directorates, down into individual teams, and in fact down into individual plans and objectives. That's laid out in our integrated performance framework, which board approved in September of last year. And then the monitoring of that will come through in terms of committee and through to board on a quarterly basis. I'm going to stop there in terms of the presentation. Very happy to pick up questions in terms of the contents of the plan.
Diolch iawn, Chris, a diolch i bawb arall sy'n cyfrannu yn yna. Waith bwysig iawn yn digwydd. Unrhyw gwestiwn, unrhyw sylw. Na i ddod y Gareth gynta sydd am roi chydig o fanylion ynglyn â pwyllgor Mae o'n cadeirio ar y gwaith ddigwyddodd yn y sesiwn. Diolch, Gareth.
Yeah, I just thought it was useful to explain what role PFIG's played, and I think Chris and colleagues have done a really good job at snatching victory from the jaws of defeat, which quite often we seem to do the opposite, don't we? But that's because we started, I think, despite the best efforts, we felt, I think some of the members of the board felt that they were not sufficiently involved if you'd asked us 2 months ago, but because PPHP, the new committee, is not fully established, and I think in future years this will largely fall to them. We've tried, and I'm very grateful to Chris and his team, to work in a flexible way to make the most difference. So what we did, we had a workshop which was open to all of the board members on the 22nd of February, when was the first opportunity we had to see a text. We had quite a deep discussion there, and actually a lot of it was about what we were talking about now, about the tone, about transparency, and optimism versus being realist. And by the time we had our meeting sort of last week, we saw we'd already seen a huge amount of change, so I think that was really positive. So what we've done now, and I think sometimes people feel that this board is just, sort of, we just get to sign things off. And of course, inevitably, it sometimes is like that. And with this, we were very conscious last week that this version, because of the Easter holiday, it's got to be something, I think Chris might have said something new. So what we've done, although other members of the board can't see the changes, is that we raised a number of issues, we documented those, and we said, well, there's not time to put a new version into these papers, but I know Chris has got got a working version with changes reflecting those comments, and I'm extremely grateful for that work, and not just obviously it applies to Rust as well. So from my point of view, I have no more comments, because I think the ones that I feel I have the opportunity to do. I mean, obviously I know Chris will do his best if there are other things we need to take on board, but we were working with a very constrained timetable. But I think particularly that workshop session we had, I know I've got the date wrong when I spoke, but it was really, really helpful. And I think this is, nothing's ever perfect, is it? But it is a really significant improvement in terms of sort of coherence and realism compared to what we had last year. So that's great.
Gareth, diolch yn iawn. Rhian nesa.
It's just a very quick thought. I was part of PFIG, and I think most of us were around the table. So we have seen this and discussed it in detail and made very helpful comments, haven't we, Chris? But I just wanted to clarify, Betsi is not the only health board that cannot produce a 3-year intermediate term plan. So I just wanted to make sure that the context was completely understood, that I don't think any of the other health boards are in a position to produce a 3-year plan at this time. Is that right?
Well, there's a little debate about maybe one. Maybe one.
Right.
But it's debatable, yeah.
That context was
it's very important.
Just emphasising in the public arena. And secondly, I'm not quite sure that I still understand what 19.7 million deficit actually means. In that, does it mean that if we have a worse deficit, we're going to lose even more of that funding that could have become recurrent, or have I got that completely wrong?
Maybe Russ can respond to that. Thanks, Russ.
Yeah, so the rules are we have to make progress towards our control target deficit of 23-24. So an improvement over our base underlying position for the 23-24 year of predominantly that would be 33 million. So the 101 million given by Welsh Government, 134 million original deficit plan, heading for 33. Our control target is 20. So somewhere between 20 and 33 is progress towards the 20 million pounds deficit. But that's a 23-24 target. As we go into the new year, the target is to deliver a break even under our key financial duty. But that is not what is predicated upon receiving the conditionally recurrent funds. That's all to do with the 23-24 outturn and being better than 33 million in deficit for us.
And can I just follow up very
Sure.
briefly? So how does that fit with the other health boards? Where are we in the league table of, you know, real debtors?
And it's worth pointing out where we come from as well. You know, the progress, not just in comparison, but that's important as well, with other health was actually from 134 million to where we are is a lot of progress.
It is, yes. I mean, so there are 2 or 3 health boards that will miss their deficit position on their original plan after they've received their additional allocation. We were out on our own as the organisation which was suggesting we would deliver what we originally said at the start of the year after the 101 million. And then there were a couple of organisations that were still forecasting delivery of the control target, which is an improvement on their start position. So we were uniquely on our own in the middle of the pack, but it is a moving feast. So that was the latest projections.
Yeah. Thank you. What else? You were not Billy.
Just wanted to ask, going forward, AI is going to impact the delivery of services and the workforce.
Question.
Objective 2 talks about digital data and technology, but doesn't address AI. So I just wondered, do we need a specific strategy or to develop one?
Really good point. So maybe Chris to begin with, and Dylan to you with it.
Yeah, fantastic point, Billy. Whilst it might not explicitly be called out in Objective 2, that's not because it isn't in our minds. Certainly, Dylan will have it in mind in terms of the DDAT element, and we'll pick up in a moment. But from my perspective, certainly, there is some really good work in Objective 5 that is already using AI in some of our pathology services, for example, and there is an oblique reference in there to that, but nonetheless, we will be growing that. And then the other area I'd perhaps call that out would be in terms of our 10-year strategy and our clinical services plan, because if we're going to do that properly, then AI definitely needs to be part of that conversation.
Yeah, well, I was going to say the same thing. Actually, we are working. We had a study day with clinicians around AI, and it will feature in the revised digital plan, which will support the annual plan. Yeah, great.
Gareth, can I just come back very briefly, just on the Rhiann's question at first? I do want to say, I mean, I support where we got to. I think it's a reasonable balance between a stretching target for achieving savings, but we do need to recognise that, and I don't want to sound like a creep, but it is true, the Welsh Government really has gone out on a limb in terms of the money that they've found for health. And other parts of the public sector are suffering as a result. So I just want to say that, you know, in my mind, we have an absolute obligation to not have a greater deficit than that target we're setting, and indeed to work in the year to reduce that. So I think that should be seen as the, you know, realistic, but the absolute worst case that we would end up with, because I think we all know that, you know, those of us who sit around this table, that there are areas in which we can do much better, and as Russ has said, better in terms of the results for the people of North Wales, as well as better in managing our money. So we really have an obligation to push ahead with that. And while I would like to set a sort of, you know, a break-even budget, I think what we're saying is being transparent and honest to the Welsh Government, but we must manage within that.
Yeah. Different, Gareth, that's a point well made. Unrhyw arall, no question cyn I mi droi at Carol. So please, Carol.
Lovely, thank you. And can I thank colleagues for the work? A lot of this work has been coordinated, of course, by the planning function, but colleagues across the organisation and the different functions have very actively contributed. Planning is an area we just talked about earlier, planning review, that we are focusing on improving, and thanks Gareth for the comments that actually this is an improved plan on last year, so that is really positive. If you don't have a plan, you don't know where you're going, so that's really key for me. A couple of elements to just draw out from my point of view. Having an everyday version is really important for people to be able to understand what we're about, what we're working on. So back to the people in your village, Jay, what are we working on? And so that everyday version is going to be very important, and that's for our staff colleagues as well as partners and others. And I know Helen and her team are working on that as well. And that's because having a plan leads to the need to deliver the plan, and so people need to know what it is we're about. So the deployment of the plan Chris has covered, and I think that's going to be really important for me. We need to become an organisation that plans well and delivers well, and we will get trust and confidence through that. So one of the key elements for the board and the committees will be what's written on the page versus what's actually being delivered, and then importantly, the difference that is being made to people over time. So all of those things will need to follow through. And then just to comment on the money, very good questions, Rian, about, well, where are we in comparison? Because it's always, to look at one organisation in isolation is probably a mistake. We need to see where we are in the context, and everyone is finding this a particularly difficult period. And that's why I think all health boards, and I'm very keen to do this work here, is focusing on value. So it's not just about the cost of everything, not knowing the value, it's the value to the public taxpayer. And we're defining the value being our outcomes, experience and cost. And I think driving through that sort of thinking to make sure that the measures we take financially are there to both promote, or certainly not to detract from, the outcomes and the experience of people, and actually many of the time to actually improve it. So that feels very important. We will get quarterly reports here to the board in terms of how we're doing, and obviously the board committees will have a specific slice of this. And then, I'm anticipating that when we're sat here next year, we have set a clear ambition to get to an IMTP to meet our statutory duty. That's got to be the goal. And this year is about moving us more towards that goal. And I certainly hope on money, but on also our planning effectiveness, our workforce, etc., that we'll be putting in front of you. This is a bit of a bold statement, and they're going to kill me later. We will have moved towards at least, being able to put a plan together that could get approval from the minister.
Certainly, great. And can we acknowledge all the work that has taken place? It's always a bit of an adventure, isn't it, putting this together? So we really appreciate, and I think. I'm sure colleagues would reflect that there's always learning in that process. The plan itself plays into our improvement and learning organisation ambition as well. The plan itself can do that. So a couple of things, I think, following comments from everybody that I'd like us to consider. One is, what about the 20,000 people who are going to deliver this for us? It's not us in the room that's going to deliver it, but it's those who work in various areas of the health board, and how they can feel part of it, and how they can feel ownership and a shared ambition. The other thing, there's always a danger. This is a challenge to myself as much as anyone else, but there's always a danger with documents like this and plans that you report on them and it's a lot of warm words. I can show you lots of reports like that I've had over the years, and I tend to describe them as requests for snow on Christmas Day, because everybody wants it and it's very nice when it happens, but what does it actually do? So an appeal in a way that we embrace what we're talking about quite a lot this morning, about being open and transparent and honest about what's working, what's not working. So in all our reporting, we can have that approach, and people will know that they will be supported. You know, there will be no condemnation, there will be no disciplinary measures or anything like that, but we will embrace it, you know, because that's the way we're going to improve. That's the way we're going to ensure we make that progress. So I think the reporting on this and the monitoring is equally as important as the content itself. I think it's it's that thing about the destination. It's not just about the destination, it's about how you get there and how you travel, the journey you take. So that's very true about this plan, I think. It's our ambition, you know, it sets out a very clear ambition, and it is ambitious. And if we achieve everything we set out, we will be in a very good place. So, but for us to achieve it, we've got to go about it in the right way, I think. So that's the challenge I'm offering us all to take forward, but also that matter about staff. How do they, how are we going to let staff know about what our ambition is and the part they can play and not, you know. So I want us to think about that. I'm sort of looking slightly at Helen in terms of the engagement team and Jason as well, about how we can have staff feeling ownership of that as well. Unrhyw un arall rhywbeth I ddeud? Os nad oes, gawn ni gyd felly dderbyn cynllun yna, gan ddiolch I bawb am y gwaith rhagorol sydd wedi gwneud, a byddwn ni'n cyflwyno i'r Llywodraeth erbyn diwedd y dydd. So I hope you're going to reach the post in time, Chris, or electronically anyway. So thanks very much again. If you pass on the thanks to all the team, really grateful, some excellent work. So diolch fawr iawn. Diolch. Reit ymlaen i'r eitem nesa, os gwelwch yn dda, ar adroddiad llywodraethiant corfforaethol, ac mae yna cwpl o bapurau wedi derbyn, a wna I troi at Bill. Anything particular for us to note, please, Bill, in what is going to be your last report to the board in your role as acting board secretary, without opportunity to say something about that before the end, I'm sure, but over to you if there's anything you want to highlight.
Chair, a couple of items, please, Chair, for me, and thank you for mentioning that. It's been an absolute pleasure to work with you over the last 9 to 12 months or so on the improvements we've made so far. Looking forward to supporting Pam in her new role. So thank you for mentioning that. I'll try and be as brief as possible. There are 4 key elements to this report. I would like the board to note and consider the corporate risk register. So very briefly, Chair, the corporate risk register report is provided in Appendix 1. It's a short summary report. The board will note that of the 17 corporate risks, an update of 9 has been provided, and all 8 outstanding risks which haven't had an update have been submitted to the relevant executive owner of that risk for an update, and that has been received. This will be reviewed by the executive team and reported to the May board. And I suppose just picking up on what you said previously, Chair, in terms of what's working and what is not working so well, you know, the timely update of risk from executive owner, which is working quite well, but then the formal approval of that is something I know that Carol and the executive team are keen to improve and to use the executive team to do that. So I think that is worth pointing out in that sense. So I'll pause at that point around the corporate risk register.
Is there anything else in your report you want to highlight?
Well, I particularly would like to highlight the appointments to the Healthcare Professional Forum and to the stakeholder reference group. So the report contains an update around the HPF, Healthcare Professionals Forum, and your support for the extension of another year for Jane to continue as chair. and under the standing orders, that's all in order, and you have written to the Minister seeking formal approval of such. So we'd like the board's support on that course of action. And then in addition to that, very grateful to stakeholders of the SRG, Stakeholder Reference Group, who've put themselves forward. I think it was one in the audience, Jeff, and Complice, for example. The details of that are in the report. We would like to have the board's formal approval of those appointments. Very grateful for those colleagues for giving up time to help us with that work.
Great. Iawn, Bill, unrhyw gwestiwn, unrhyw sylw ar y adroddiad yn ysgol yna? Caroline. Ie.
Un o'r, wrth gwrs, fel cadeirydd, ydych chi wedi gofyn i fi yn ddiweddar gadeirio QSC o hyn ymlaen. Dwi ddim wedi cael cyfle i fynd o'r cyfarfod sydd eto. Ond dwi yn nodi fydd yna nifer fawr o faterion ar y disk register sydd yn gyfrifoldeb i QSC. Tri ohonyn nhw hefo sgôrs arbennig o uchel ar hyn o bryd, a rhai eraill angen i adolygu. Felly mi fydd hwn yn rhywbeth dwi eisiau rhoi sylw arbennig iddo fo yn y pwyllgor hwnnw dros y misoedd nesa.
Iawn. Diolch yn iawn am hynny. Unrhyw arall cyn i mi ddod ell? No, Gareth?
Well, just to say, first of all, I'm delighted that Jane's willing to carry on. That's really good news. And I strongly welcome the change of stakeholder reference group. So I think we should be grateful to you, Mike, as well for that. Just on the risk register, I hear what you say, Phil, and it is true. I'm slightly nervous about the time scale it takes to work its way through, because I actually think the product now is excellent. They're really, really good. Thoughtful, analytical, action-focused risks. So, but I don't know, we get them sort of saying the 3 actions due to be completed in January 24, and you think, yeah, well, that's because it's, So, but, that's a relatively minor caveat at what I think is good progress. I did want to ask, which is, I think I'm going to probably look at the rest, that we've still got a 5 rating, as in on the likelihood probability scale on not achieving our financial plan, and I just thought that seems a bit odd, given that we are still, I think, as of 2 days to the end of financial 3 days, forecasting a sort of that we will reach the 33 million, possibly a bit below it. So I mean, that may just be a time thing, but I just wanted to flag that out. And there were 2 other points. One was and it's a minor point, but I think it's really relevant because the electronic health record is so critical. I know we're discussing that separately. But there's an issue about how how far you go in backloading the data, and I think at some point we need to have a discussion of that, because I don't want to sound really insensitive, but as we know, vast majority of our patients are elderly. So inevitably, by the time we introduce this system, there will be records that relate to people who are no longer with us. And clearly, I presume that there's absolutely no point in that. So we just need to look at what we can do to manage that task. Because obviously, if patients who are still being treated by us, it's absolutely essential that we do backload it. So a very detailed point. And the final one, I mentioned it earlier, and I just like some assurance, because we only get to see, I know, a certain level of risk, but I have been struck, and it wasn't just that one comment, by the fact that in our community services, and particularly with the mental health ones, that that they feel overwhelmed, and they are conscious that they are managing caseloads that are far larger than reasonably managed. So I just would like some assurance that that is appropriately being registered and dealt with within the organisation, even if it hasn't made its way up to us.
So on that risk in particular, then is it?
On that risk in particular, David, I can confirm that there's a risk management group meeting that we have, and the next one's on the 9th of April, and the team have been asked to position formally an update to that group, and that will be reported to the executive team on that matter. So got that update for you. I'm happy to come back to some of the other points raised, but I know Carol had a hand up as well.
And the electronic record, we'll have to discuss later on, maybe about that. You can ask Dylan to take up that matter. And Carol, some comments on this report?
Thanks very much. Just in terms, Gareth, of your comments around process. So I think even when I joined the organisation, there was a lot of focus on risk identification. I think there was a less of a focus, I'm not saying it wasn't happening, but less of a focus, a visible focus on risk management. And that's where I think the value of having the executive team discussion on the actions that are taking place and the impact of those actions and whether we're actually managing risk, reducing it, mitigating it, etc., rather than the sort of machine of, you know, reporting. So it is a work in progress. This is an area that is usually reviewed by audit each year annually. So we'll be able to measure progress on that. And of course, as Pam starts, we'll bring her expertise to this as well. And I'm sure Russ will be able to pick up the finance issue.
Yeah, and that finance thing, Gareth was referencing, sort of proves it's a live document, of course, isn't it? It's not set in concrete, but it's, you want to make some comment on that and the risk you're carrying.
Yeah, it's a brave finance director in the current economy through the health boards that suggests financial sustainability is not a risk. So I think there is two things really. So first, we're looking at the actual documentation of the risk. So financial sustainability, and clearly we've just discussed an underlying deficit of 250 million is a very challenging position as we go forward. But the descriptor of the narrative of the risk suggests it's centred upon or centric upon delivery of in-year performance. And the risk around in-year performance is obviously mitigating. So we are due to meet again at Risk Management Group, and we're going to debate the alignment between the narrative of the overall risk and the component parts. And the balance will probably mean that the risk will come down, and that's the recommendation as we go into Risk Management Group. But then it takes a number of months to resurface back through up to the health board. So from a financial sustainability perperspective, we're still high risk.
That's a really fair point. So it's a question of just making sure the narrative is right, because in the medium, well, the ongoing perspective clearly is a risk. But that's really helpful. Thank you for that.
Karen, also from perspective of audit committee chair.
Just to sort of endorse what Gareth said around, and Carol, I think, around the progress that has been made in the last 12 months, that we're at this position on the risk reporting. Obviously, we look at this in detail at the audit committee. One of the things that came out of the committee, and apologies if I just nipped out for that 2 minutes, Bill's already covered this, but particularly in link to assurances and on the financial plan, it was stressed that the committees are not a form of assurance. And so this paper's probably just not been updated in time between board meeting and the last committee, but just to make that very clear, they are not a line of defence, so that will get fine for the next airing.
Thank you, Karen. Diolch yn iawn. Unrhyw un arall yn cwestiwn sylw? Os nad oes, ydy pawb yn hapus I dderbyn yr adroddiad yna a'i gymeradwyo os gwelwch yn dda. Yn hapus? Diolch yn iawn. Ymlaen yn i'r eitem nesa 2.5. Cynllun cydraddoldeb strategol am 4 mlynedd 2024-2028. Dwi am droi at Jason I gyflwyno os gwelwch yn dda. Ac nodi bod unrhyw bapurau wrth gwrs dyn ni wedi darllen yn fanwl os modd tanlinellu unrhyw materion dych chi eisiau dwyn i'n sylw ni, ac dwi'n gweld Ceri yma hefyd falle bydd yn gwneud cyfraniad. Diolch Jason.
Diolch Chair. As you noted, we'll take the paper as read, but just to note 1 or 2 key things really. This paper helps set out the strategic intent for the organisation, and underneath that a number of key pillars have been developed. They've been developed through consultation across the organisation. The Quality, Diversity and Human Rights team last year commenced an engagement process which included both surveys, it included face-to-face meetings, but also as well it included meeting with our local partners, because we do have a number of reference groups that allow us to check and challenge whether or not we are developing policy in the most appropriate way and reflecting the particular communities that we have and the protected characteristics within our population. As we go forward, the Equality and Diversity and Human Rights will form under the People and Culture Committee, and so it will form a really key plan for that. Obviously, that's a newly established committee, and as yet we've not been able to go through that formal process, but what we have aimed to do is to share the document and take it through with executive colleagues, and we've made a significant number of revisions in the development of the document. Just to note as well that some of the language that's used in the document comes from a national policy perspective, and so say for example some of the aspirations, and particularly one example of that is being an LGBTQI+ friendly organisation. Well, the descriptor of that comes from the national plan from Welsh Government, and also as well aspirations in relation to race equality and being an anti-racist organisation. So it's just to recognise that sometimes with a document like this, some of the terminology, you might think, well, where's that stemmed from? It stemmed from both the statutory requirements, but also as well, it will have stemmed from as well the consultation processes that we have today. The other key thing that I'd just say is that it is a working document as well, so it's an initial scoping plan for 4 years, but we recognise that it can't just sit as a separate piece. So each year, the relevant annual plans will then need to focus upon the key areas and priorities that we have across the organisation. But the aim, hopefully, that you'll see within this document is that it hopefully links in terms of the language that we've been talking about today, both within the annual plan. It also links as well in terms of the language around the type of organisation that we want to become through our culture and our engagement. With workforce and the wider population. I've worked really hard to try and develop something that encompasses so many separate areas, and I'd just like to thank them for the work that they have done, because I know that they're really committed to this. And also as well as Chair had described, Kerry, who was our Head of Equality and Diversity and Human Rights, is with us today, because as the report author that sits behind us as well, if there are any particular technical questions that you might have, well, it's important that we've got the right person that can help answer those. So hopefully this document gives you a bit of the direction about who we want to be as an organisation, and it's an iterative document as well that we will change to reflect where we are. Thank you, Chair.
Diolch yn iawn, Jason, ac hefyd diolch I bawb sy'n bod yn gwybod gwaith. Diolch, Kerry, hefyd am bod yma heddiw. Cwestiynau, sylwadau gynta, Dyfed, wedyn Wrtha, wedyn Karen.
Diolch, Cadeirydd. Dwi'n meddwl bod mae o'n braf gallu darllen y ddogfen yma, herwydd mae hwn yn rhywbeth hynod bwysig I ni fel bwrdd, bod o'n dangos yn commitment ni mewn ffordd i'r maes yma. Mae o'n mor bwysig. Dim yn unig, da ni'n cynrychioli 700,000 o boblogaeth, ond hefyd 20,000 o aelodau staff. A dwi'n meddwl bod gallu rhoi yr hyder yna I bawb, bod ni'n cymryd hwn o ddifri mor bwysig. Mae'n drist gweld yn ddiweddar fel mae sefydliadau yn dod o dan bwysau yn ariannol, bod y maes yma'n rhywbeth allu'r gael ei bwsio o'r ffordd, a mae hynny yn pryderu rhywun, ond dwi'n falch o allu deud ddim dyna sy'n digwydd yma'n hyn. A dwi'n croesawu y pwynt mae Jason wedi wneud ydy bod hwn yn dod o flaen y pwyllgor pobl a diwylliant mwyn gallu cael ei fireinio fa mewn ffordd wrth I ni symud ymlaen, felly dwi'n croesawu hynny. A diolch i'r tîm sydd wedi gwneud y gwaith caled ar hwn. Diolch.
Diolch yn iawn am wneud yn tip pwysig yna. Wrtha, nesaf sgwrs.
Diolch am ddod yn y adroddiad yma. Really nice to see the work that's gone into this report. really pleased also to using the word iterative, because I think in a field like this, it will always be changing and it will always be under review. So that's really the point. I think it's a really important point. If I can, I'd like to ask a little bit about the partners. You said you consulted with partners. I just wondered who you've made contact with in developing this strategy.
Great. Okay. Well, that'll be a joint answer between both Kerry and I. One of the pleasures that I have is I chair an equality forum, which is made up of a number of separate organisations across North Wales, and that includes, say, for example, organisations that represent ethnic minority communities, represent, say, for example, deaf populations, and there's a whole variety of people that are on that forum from a number of different groups who know the organisation, and they're people that use our services here in North Wales. So we have that formal forum that we have. But Kerry, probably, if you want to expand on that, that'd be helpful.
We actually have two forums. We have an important stakeholder and then you mentioned that to make sure that it is fully represented. Of the different communities. That's a chiefly forum, which is the one that Jason is referring to. In addition to that, we work closely with NICE, who is a member of both of those groups as well. We work closely
Next.
That was just a couple of comments, quite really nice to see you again, Kerry. I'm just a little bit confused with the interchange between equity and equality, understanding both in terms of what they both mean, obviously, but just there seems to be, I just thought there was a confusion through the paper around where we were referring to equity and equality, and on page 9 there was an essay saying we're aware of health equalities. But I'm not sure whether that was meant to say inequalities, but
it's just been amended.
Right.
And that's sort of confusing. But I wondered what, and it picks up on what Earth was saying around what you're doing in terms of engaging with other sort of partners and third sector bodies in particular, and whether you're connecting like with Children in Wales as the third sector body for children's rights.
So we're making the steps. Like I said, we're expanding our engagement. We're working closely as well with the engagement teams to the Health Board as well, because those are links that we may not have been aware of. And so the next 12 months is about growing that knowledge and coming outside from the office into the public areas to have those spaces. It's a growing area that we will hopefully be able to reassure with in the future to see that in the document.
Thank you very much. And the committee can support that work, can't it? you're a member of that committee.
People, yes.
Yeah, great. Rhywun arall, unrhyw bwynt, os nad oes wneud o Carol, efo rai sylwadau, Carol.
Yeah, and thanks very much, Jason and Kerry. Support the comments of the board in that, you know, the discussions we've had earlier about this is an organisation that's changing and improving. And we've talked about live documents, and so I think this grows and moves with us as we go forward. The other thing that we referred to earlier is understanding the impact and what people think about the things that we're doing and who we are and how we operate. So some of the tests for me are about what changes as a result of the work that we do. So I think there's something about us thinking more about that and being able to measure a little bit more the views of people and the feedback we gain, whether that's sort of being a good partner as one of the objectives, one of the priorities in the plan, or if it's more broadly about some other absolute indicators. I would like to bring a slightly sharper focus on data and feedback into this area. So we know the effort, huge effort that's being made is resulting in difference. So, and it's great that it's under the People and Culture Committee, because this sort of work is about who we are. So that's great. So I think there's going to be a more detailed sort of delivery plan. We need to be assessing any cost implications, which is another discussion about money. So we will take that forward if the board supports us.
And progress monitored through the various forums you've referred to, and also the people at the Okay, cheers.
Thank you, Chair. And probably just to wrap up on those points, you're absolutely right. Data is really, really key. And what we have within Wales is our workforce equality standard, which will allow us to interrogate data in a way that we've not been able to do before, to look at what progress we're making, particularly initially with race, but then obviously in relation to disability. From my experience of using that data across the border, that's really important because that helps drive some of the change in terms of who we are as an organisation, because it's evidence-based. It's evidence-based rather than being quite subjective in terms of have we shifted the dial, for example, in terms of being a more representative workforce, in terms of being an organisation that makes sure that we treat people regardless of all of their ethnic backgrounds in the same way through conduct processes. So there's a lot of underpinning work that sits underneath this to help drive who we want to be. Thank you, Chair.
Diolch yn fawr iawn, Jason. Dwi'n dod o'r adroddiad i ben, Kerry, sori. Diolch yn fawr iawn am y cyfraniad. Gai ofyn i... Oedd yna rhyw pwynt allweddol, Kerry? Did you want to make a significant point for a few seconds?
Literally a few seconds. I just wanted to feedback regarding Carol's point around how it feels. So this month we're in the holy month of Ramadan, and for the first time we've held staff iftars of the 3 main hospitals. We've held 2 so far. The last one was last night in Bangor. The feedback we've had from our Muslim and non-Muslim staff about how much they appreciate the information that they receive about how to care to staff, how to care for patients during Ramadan fasting, what it's meant for staff to be welcomed has been huge. I'm more than happy to feedback some of the comments that we've had, but that's what we're aiming for.
Diolch yn fawr iawn, enghraifft da iawn o'r gwaith rhagorol. Pam nac ys i dderbyn ac i'r gymryd drwy'r adroddiad. Diolch yn fawr iawn i chi ymlaen. Gyda diolch i'r eitem nesa, eitem 2.6, ydy pwrpas busnes yr ysbyty yn y Rhyl, y roi o Alexandra, ac dwi'n meddwl Carol sydd yn mynd i roi peth o ddiweddiad falle dros hefyd, da ni wedi bod yn cyfarfodydd.
affecting people in Flintshire. The long and short of the story really is that it is a full business case that couldn't attract the support of the Welsh Government, even though in principle I think it was supported, but was significantly financially prohibitive. So a few months ago we agreed to take another look at this in terms of what the art of the possible could be. Had a series of roundtables, and if I could just thank colleagues from local authorities in Denbighshire, Conwy and Flintshire for active participation in that, and colleagues from Welsh Government. We've been working, I think, collectively to see what the art of the possible is, and we've got to the stage where important, significant, very rapid work has taken place to develop some proposals, praise the options, and help us to look to steer this to the next step. And it is, whilst it is more modest in terms of the sort of cost envelope, what was stressed to us in our latest roundtable was that actually a lot, if not most of the elements that were in the original business case now feature as well in this. So I think this is a really important step forward to see if we can actually start to get this over the line, and is an important development. I'm going to just hand over to Chris to add to that, if I may, Chris.
Yes, you may. I was looking over at Gareth a moment ago. There are some others who remember this journey, sat around the table. I was first involved in developing a proposal for the Alex when I was a GP in Renal, and that's over 10 years ago. So this has been a long time in the making. It is a more modest proposal in front of us, but it's also a more realistic proposal in terms of its likelihood for support. And I would just reiterate what Harold has said in terms of the really important additionality within the original case is still maintained within this. Of course, there is a significant part of this that relates to updating the fabric of a decaying grade 2 building. But there's a lot in here that signals the direction of travel of an organisation that is looking forwards. There's a lot in here about partnership working. There's a lot in here about understanding that the solutions to wellbeing don't sit in healthcare or organisations. There's a lot in here about understanding different models of delivering care that demedicalise. So the proposal is well supported amongst colleagues that have been involved. It helps to improve the provision of services from the Alex and move away unnecessary use of services in COVID, particularly the emergency department. Probably 1 in 7 cases, and that's maybe a conservative estimate of tendencies in emergency departments in Grand Clwyd could be addressed through the provision being offered here. I think really that's most of what I wanted to add, other than to just remind us that in terms of the Welsh index of deprivation, the 2,000 or so wards, the top 2 are in Renal. This is really important for the Renal community.
Yes, and I think we can share the feelings that people have expressed to us over some months, actually, the meetings we've had, particularly with our colleagues in local authorities, and the support there is to ensure there is progress and there is an appropriate facility on this site in Renal. So that's really important. Diolch yn iawn. Unrhyw gwestiwn neu droi at Mike gynta?
Yes, in relation, I accept we've got a business case for this, but when we becomes more of a realistic project, where in the process do we involve the end user, you know, the people, the public that come in, and the cleaners, the doctors, the nurses, whatever, to ensure that we have a practical building? I've quoted this before, but we had the local GP surgery, which purely by accident, with COVID, they managed to have a controlled flow of people in and out without kind of, you know, crossing each other. And considerations like that, I'm very keen that the end users have an input or have a look at, you know, that'll work, that won't. Is that anywhere in the process?
Mike, good question. Chris, getting people involved in the design?
Solidly so. So just to give you assurance in terms of input so far, then individuals from those groupings have been involved in identifying what the opportunities are within the building and in terms of the opportunities of moving services and what those services should look like to work for them as professionals as well as for the public that we serve. But when we get to the point then where we have a viable proposition on the table that has got the necessary support to then move forward into delivery, there is no way of doing that without involving, well, there is a way of doing it without involving those folks. I think that's the point that you're making, but there is no way of doing it successfully without involving those folks. We're very clear about it.
That was a successful answer.
Rhywun arall? Cyn I mi droi. Gareth.
Yeah, I strongly support this. I'm particularly enthused about the idea of minor accident and ailment unit, minor incident and ailment unit, right in a minute, because I think that's definitely something we need to build on. I just wanted to say that I recently visited Ruthin Hospital and also the CRT in South Denbighshire, which is interesting because obviously it's Denbighshire, different part, and that seems to be working really well, particularly in keeping people out of hospital and keeping people specifically out of the district general hospital. And so, you know, there's a model very locally that we should be able to work on. I hope partners will embrace that. But I did want to say that particularly one of the things that struck me there with the CRT was that there were a very good relationship with the GP surgeries. So I think they have a daily conference on particularly vulnerable people where they assess who's going to do a home visit and what needs to be done to keep them at home. So, you know, it was really good to me to see something that's working really well and actually involves very good joint working relationships with the local authority. And you know, this is a way in which I think we've got something to build on physically that we can replicate that. So
good. Diolch yn fawr. Rhywun arall? Os nad oes, Carol, some suggestion of where do we go from here and what the process is likely to be going forward, maybe?
Great, thanks very much. So we've been pedaling very quickly on this, and fantastic efforts have gone in. So we're very keen now to get this stage supported by the board today and into Welsh Government for consideration. What usually happens is that there's some further dialogue with government. Importantly, we've got the health part of the government's capital team and the integration part of the government's capital team together. We're having those dialogues because there's two different funding streams. So that will be submitted. The work to continue to revise that for business case will then move forward. And Gareth, the comment really about the care closer to home approach, we're going to nail that down in more detail and in terms of that minor injuries and ailments approach. So they're the really key things that have come back. So a bit more detail on that so that everyone is satisfied and it's deliverable and sustainable. And then you can see that we are wanting to get, what they call it, spades in the ground or whatever the term is, as soon as possible. And the people of the local area, I hope, feeling that we've taken their needs seriously. So that's the time frame going through.
Diolch yn fawr iawn. Unrhyw pwynt arall? Os nad oes pawb yn apus i dderbyn yr adroddiad a'i gymeradwyo fo, sgolch yn dda, a nawn ni ddisgwyl yn ein garni. Mae'n ddrwg iawn i, Karen.
It was just a quick one, Carol, because I wasn't clear from the documentation or your narrative at the end. Is there expected to be some disruption to patient services? What if an option to any of the options are closed? Is it going to shut and then reopen?
So the main development isn't actually a new build. The disruption in the main building, there are some patient services, no overnight services, but there are some patient services. So as part of the planning, we will need to be clear about if there's a decant, what the decant facilities look like in the plan.
Yeah. Not dissimilar to what's happening in London, in a way as well, that
Thank you.
Additional building, but taking care of the way it impacts on services. Diolch yn iawn, pawb yn apus I dderbyn ac I gymeradwyo'r adroddiad, sgwelwch yn dda, ydyn, ardderchog, diolch yn iawn, a nawn ni ddisgwyl I weld beth yw'r datblygiadau a gobeithio cael cymeradwyaeth gan y Llywodraeth maes y law. Ymlaen i'r eitem nesaf, eitem 2.7, ydy yr adroddiad sicrwydd bob 2 blynedd ar hyd yn ffynio ar deddf lefelau snafio nyrshiau Cronfachau Cymru. That long title must mean it's your report, I think. Or is it Angela's? It could be. I'm sorry. It's sometimes it's Nick, but now, yours is the next one. The equally long title. But is there anything you wish to draw attention to on this report, please, Angela?
Thank you, the Chair. Just to let colleagues be aware that the Nurse Staffing Act in Wales was brought in 2016, and their expectation is that we undertake a 3-yearly report. An identification that we've met the Act across the organisation, and that we've been assessing the Act wards, which are 25B wards, are in patient acute areas. And you'll note that we have 6 monthly reviews that come back here, our next one being due in May, following our establishment reviews, where we look at the staffing on the wards, the acuity of the patients, the errors in administration or patients falling development pressure source, and coordinate that with professional judgment to see whether the nurse staffing levels are appropriate for those areas. And you'll note in previous board meetings I've come back with recommendations for extra funding and investment, which we've been really fortunate to be able to secure, and those nurse staffing levels are now being met. So this is I guess a 3-year summary of the work that's been undertaken. It does have to fall in with this board meeting because of the way it has to be submitted to Welsh Government. I think every health board in Wales is presenting this to the board today because of that timing. We will submit to Welsh Government at the later date in October as identified. It was presented at the exec team last week for discussion, and you'll note that latterly that is included the information about the funding that has been put in, and the extra nursing and healthcare support worker staff that we've had across the organisation, and that was in line with establishment reviews and also meeting the Act requirements for the 26.9% uplift, which we then had to apply to healthcare support workers, which was the reason we had the increase. But that, for the presentation, I'll take any questions.
Great. Gyfran, Angela, unrhyw sylw cwestiwn? Billy?
Yeah, I just wanted to ask, from my experience and that of some of my RCN colleagues, the patient information boards on wards that fall under the Act are poorly maintained. Given the data that was in the paper, are we confident that we're being sufficiently honest with patients and the public when we're not meeting the Act and the statutory duties?
Yeah, well, I was thinking about that whilst I bring Rhian in. If that's okay, Angela, then you can respond to all those queries.
Again, I think it's just to clarify my own understanding. The Act only applies to a certain percentage of the wards. I remember when a report came to QSE, I asked how many wards there were in total, and I think it was 105. And so fewer than half of the wards actually fall under the requirements of the Act. So that was the first thing. I just wanted to make sure that I got right.
Yeah.
And I think the second thing was, even though the other wards don't fall under the Act, that is still your aspiration for them as well, isn't it? Although you haven't got the same legal obligation to staff to that level. Yeah, thank you.
I've just checked, Inara, I have a question. No, so those sort of relate to each other in many ways, don't they?
Absolutely. So from the point of view of Billy, we did have an assessment undertaken from the Royal College around the accuracy on the wards, around the boards, etc. I think during COVID, the attention to that had fallen off slightly, and we hadn't been as attention to detail on that. I did identify that I wanted them to give more information, really, because the recommendation from the Welsh government is that we provide the number of staff that should be on duty, which is okay. The number of staff that should be on duty compared to the number of staff that are on duty is a different dynamic. So we're refreshing those boards at the moment, and I've commissioned boards for the whole of the health board, so that each ward has got the actual staff that should be there and the staff that are actually on duty on that day. And then we can then provide much more information. So I agree, we're trying to make sure we're up to date for now, but the progress will be for us to have that transparency a little bit more outside those doors of the wards. And then the patients and the relatives are understanding exactly what pressures are on the ward or what is happening behind the doors. From the three-hand question, yes, it's only a proportion of the wards that are covered by the Act. However, we are undertaking establishment reviews across using the same methodology. So we're triangulating the harm, we're using professional judgment, and we're looking at what the acuity is, because the cohort of patients that we have in some of our community hospitals in different areas are very different to they were a number of years ago before COVID. So we're making sure that we've got that in place, and the check and challenge meetings that Jason and Russ support me in to look at what has been brought forward as the requirements are really, really useful for the staff to get that feedback as to where we are, what we're doing, and then we can come to board with the understanding that from a financial point of view, from a HR point of view, from a nursing, patient safety and quality point of view, we've done that discussion and understand where people are. We're just currently doing the emergency quadrant reviews, and we're also undertaking a mental health learning disability review, which hasn't been undertaken for a serious amount of time. So we're really pleased that there's engagement across the organisation, and staff are very keen to come forward. They don't always ask for extra staff. They understand that there needs to be a different skill mix. They might identify that they need different staff in different areas. So we're working with them, but there's that confidence across the organisation now that we're looking at that on a regular basis. So the non-staffing Act wards will come every 12 months. The staffing Act wards will be every 6 months as per legislation.
Okay, thank you.
Nad oes pawb i dderbyn yr adroddiad yna Cymru. Diolch yn fawr iawn i chi, diolch am y gwaith ar y adroddiad yna. Ymlaen i eitem 2.9. Eto, Nick y tro yma, fod gyfrestyr unigwyr cymeradwyo ddiweddaru'r gyfrestyr eitem sy'n dod at ni yn gyson wrth gwrs. Nick, over to you for this report.
Thank you, Chair. Perhaps I could take just a moment to remind the some new faces around the table what this is about. Approved doctors have considerable powers under the Mental Health Act 1983, and there's quite a rigorous approval process for those doctors. Betsi Cadwaladr carries out that function on behalf of all the health boards in Wales and indeed private providers to ensure that there is sufficient expertise in that approval process. And this mirrors 4 approval panels in England, and we work closely with those approval panels to ensure there's quality assurance and consistency. The 2018 directions require that this is seen by board and for endorsement of the delegated authority I have between board meetings for those approval processes. So Chair, happy to take any questions, but I hope the report is self-explanatory.
Diolch yn iawn. Pawb yn hapus i gymeradwyo? Unrhyw gwestiwn? Pawb yn hapus i dderbyn y gymeradwyo? Diolch yn iawn. A diolch i chi am y cyfraniadau. Dyn ni am gymryd egwyl. Ac fyddwn ni'n ail ymgymryd 10 munud ysgolch yma. So 10 minutes we will make a reach last. Diolch i chi os ydych chi'n gwylio. Mae gennych chi 10 munud o egwyl. Dyn ni ail gychwyn. Diolch yn iawn. Diolch a chroeso'n ôl I bawb I ymuno ni unwaith eto. Ymlaen ar agenda ar eitem nesa ydy eitem 4.1 sef adroddiad gwella ansawdd ac mae yna gryn dipyn I drafod yn yr eitem yna fel ydych chi'n gweld ar yr agenda a dwi am droi, dwi'n credu os dwi'n iawn, Angela sy'n cyflwyno'r adroddiad hwn. Angela, dros at y ti.
So the colleagues will be aware of the report coming on a regular basis to the board to give information about quality matters across Betsi. We have tried to refine and review the report as we've been going forward to make it more informative and to make it user friendly. And going forward, the integrated performance report will have the narrative, the data in there with an exception report behind it to allow us to discuss it within performance arena. But we're actually going to be concentrating more on the narrative from a quality perspective and what our improvements are and the so what of what we're actually doing across the organisation. So it is an iterative version as we're moving forward, and feedback outside the meeting would be really useful of what would be more useful in the presentation or how we can refine it further. From a quality perspective for the last period, the key points to note are around the main themes of nationally reported incidents, remain falls and health acquired pressure ulcers. We are leading improvement work across from the quality team's perspective, led by executive deputy directors of nursing. We've got two improvement groups that are working on falls and on HAPUs, and the quality committee has received deep dives into both of these areas and are monitoring the improvements as we go forward. 3 never events have occurred within the period identified within the paper. And the coroners continue to raise issues in a number of areas which we are addressing and taking forward. Electronic health record is one, and as you heard earlier, we are working for a sustainable solution for that to be taken forward, supported by Welsh Government, alongside ambulance delays and quality of investigations. And again, I identified earlier that we're doing a deep dive and a piece of work on reviewing the investigations that we've undertaken for inquest, to make sure that they are robust for the inquest coming forward, and that there's any more information that needs to be collected. We are undertaking that with the integrated health communities and divisions to do that. A number of Regulation 28 notices have been received by the coroner, as I say, reflecting some of the areas discussed. And then we are working on the number of overdue complaints, which still remain high. We did, when I first arrived into post, have some success in reducing those numbers, but we are seeing that they are increasing again, and we're working with the teams to identify what the barriers are and what the hold-ups are within those processes. Process mapping the pathway of receiving the complaint into it being assessed and signed off by the organisation and submitted to the families and to the patients. So that work is being undertaken and supported by NHS Executive currently. And we hope to have a more streamlined process to be put into place, but also to make sure that we ensure the quality of the responses are there and the lessons are learned from those responses to ensure that we can put things in place so those complaints don't necessarily come back again in those areas and across the organisation. Work is underway to develop the initial quality management system, as has been identified a couple of times previously in this meeting, and that framework will be provided to the board for agreement at the end of May. A little highlight in some ways is 88% of respondents of the patient feedback survey were satisfied with their overall experience of care. For me, that gives us a lot of leeway though for that that other percent that is not getting the care that they actually want to receive from us. And we need to make sure that is a consistent message as well across the organisation. We are working to make sure that we're getting feedback from our emergency areas as well as our neonatal areas and other areas across the organisation to identify if there's more work we need to do and capture that experience and make sure we can make the changes that are required. The positive again is about the submissions of our grading system. So You'll remember we introduced a grading system to allow staff to identify when colleagues have gone above and beyond, or there's been really good outcomes that have happened. And we're now getting that on a regular basis coming through. So over 1,000 submissions for ratings. We've also been recognised nationally as taking this forward, and there wants to be an adoption across Wales around this. Apart from that, I'm happy to take any questions.
Iawn. Unrhyw sylw yn y cwestiwn, neu droi at Fôn gynta, wedyn Mike, wedyn Gareth.
Ia, adroddiad defnyddiol, mae'n siŵr I fi, dwi'n gallu gweld beth sydd wedi digwydd yn y chwarter dwytha, dwi'n gweld sydd o'n chwarter cynt, chwarter cynt, y blwyddyn gynt. Da ni wedi gweld lot o ddefnydd o adroddiadau sef o lot o infographics a felly heddiw sydd wedi bod yn wir, wedi bod yn hawdd, a fyna lai o eiriau. So, dwi'n creu mwy o waith, ond os modd cael rhyw adroddiad sy'n deithau o hwnna'r gynnydd, mae yna un sylw yn dweud does bod gwynion wedi cael ei atab oedd I fewn 30 diwrnod yn uwch yn y chwarter dwytha. Mwy o fanylder fel ella, ond heb creu mwy o waith. Weithio mae llai o eiriau ar infographics a lot mwy.
Diolch yn fawr. Na I ddod â eraill mewn cyn I Angela ymateb, ond y trajectory, fel dwi'n sôn am drwy'r amser, sy'n bwysig. I'll just bring others in, then you can respond to the comments. So, Mike, Nessa, within Gareth.
Yeah, mine's just a small technical question, really. It's probably, hopefully, for Mike over here. I can't resist asking a lawyer for free advice. But, am I right in assuming that the coroners cannot, they can only make recommendations and can't instruct us or impose anything? Is that correct?
Hold that thought, Linda.
Yeah.
So that's a question to consider in a second. Gareth?
Yeah, it's very useful report. Vaughan's comments, I think, are helpful as well. I'm quite concerned about, and I want to make this clear, it's not about the quality team. In fact, having had some recent briefings, I think they're absolutely excellent. But I'm quite concerned about the issues which are flagged up here about the timely submission of documents and the quality of investigation on the one hand, and the question which you've already talked about overdue complaints. And from my possibly faulty reading, if we received 450 complaints in the last month and quarter month, isn't it? And close 318, it means the backlog's getting bigger, not smaller. And the reason I'm concerned is I've really been struggling with this because when I go out and about, you know, almost without exception, the people I meet are really, empathic, compassionate, keen on responding to the concerns of the people they're dealing with. And yet, in these sorts of areas, which often really touch people's lives as well, there doesn't seem to be any connection made between, filling in the papers and what it means to people. And I think we need to do something about that. And the solution, I think, is not a big stick or saying, well, we have to do this because the Welsh government wants it. Because what I think people see is this is all just like, it's stuff they want. And I think what we need to do is make the connection with the people who are at the receiving end. And I mean, it's something I need to talk to Helen about, obviously, but I think we need an internal comms campaign, which in my head is something like, what if you, and it's, what if it was your parent who had died because things that weren't clear, that you weren't clear they'd been done right, you'd submitted a complaint, you didn't hear anything for 3 months, and then you only got the letter, you spelt your dad's name wrong. Because it needs to bring it home that there is a connection to real people and their feelings and their well-being, just as much as there is with the patient when they're sat in front of you. And I really think we need to work on that because it underlies, and I've seen this not just in the quality patients, I've also seen it the way we deal with our staff, and comes back to compassionate organisation, where staff involved in disciplinaries or whatever, we treat appallingly, because we don't have any fellow feeling about how it would be if it was us. So I think if we could work up, they don't need to be real case studies, but some short case studies about, this is what the process is intended to do, and by not doing this is the impact it has on people's feelings and well-being. I think that would be a really powerful way of perhaps to try and change the culture.
Chair.
Give it down, Gareth. I'll just bring Angela just to respond to those and then, okay. Caroline.
Yeah, just to add to some of the points that Gareth has made there, in terms of you know, the staff doing some of the reporting and data capture as well. You know, in my experience, it's a lot easier to capture the report, you know, live and keep systems up to date. Really pleased that we are, you know, developing an electronic health record system. But we already do have the nursing system. We have other systems which should already be used. But, you know, we need to emphasise the importance of timely recording of data. But also we need to make sure that, you know, staff are aware. It's a lot easier to record the data at that time and making sure that things are up to date for everyone. You know, for example, when shifts are changing, the information is there. It's a lot easier to get things right in the first place than it is to then retrospectively prepare reports when complaints are made or once the coroner has identified something. It's so time consuming to go back and compile a report where that time will be better spent avoiding those issues in the first place. But could I ask as well, you know, the frontline clinical staff in particular, do they have time during their working day to record? But also when we are expecting reports on data, is that time built into their working week to enable them then to compile the reports that we expect of them?
Sorry, was it Jane or Caroline? Jane, sorry, I'll allow you to come in then we'll go back to Angela. That was quite a list of questions. But Jane.
It may be part of the work in progress, but I just wondered around the clinical effectiveness part of this report and whether going forward that would be a sort of a more substantial part, and thinking about the value-based work and patient-reported outcomes, and we don't seem to see much of that in terms of quality. So it's more of a reaction to things rather than that sort of forward look to clinical effectiveness. So just what the plan would be around strengthening or growing that part of. Okay, thank you.
Over to you, Angela.
Thank
All
you.
those points, sorry.
Okay, so Yvonne, from your comment about the infographics and trajectory. So the plan is from the May board, the integrated performance report will have all of the trajectories of complaints, of national reported incidents, to falls and HAPUs, etc., so that we can see that moving forward. Unfortunately, we weren't able to get it to that point for today, but it will be there from the main perspective. It is really pleasing in some ways to see from a 19% start to where we've got on the timeframes for complaints to 40, I think it's 42 something at the moment, but that isn't anywhere where we need to be. We need to providing them in a timely manner, but they need to be of the quality, and we need to not have people waiting for a long time to get them. But that information will be there in the next board. From the coroner's point of view about not being able to impose, I don't know the legal framework of it, but I have never suggested that I wouldn't follow what the coroner's been suggesting to me, because they've come from a very supportive way of actually identifying how we can improve. So I don't know whether there is legal advice on that, or Nick might know that we don't have to follow that. But I think it's good practice, and obviously that working relationship. Nick and Carol meet with the coroners on a regular basis to have the conversations, and obviously we are under the spotlight at the moment, and we want to make sure that we're doing everything we can to address some of the issues they're highlighting, that maybe that we've not had the bandwidth in the teams to be able to pick up previously. So but we can clarify the legal position, but I think we just need to continue as we are addressing the issues that they bring forward for us. From the timeliness and the backlog getting bigger, I agree, we've got some issues. We've got some complaints that are coming in currently that we've not been able to address because of certain issues. They are held up in a system at the moment, and we are working that through as we speak. We are trying to increase our opportunities to meet people who are complaining, so that we're not having to have a number of teams coming together to get the information, to write the reports and to take it forward, and to be able to do that face to face with a recording of the meeting, so people can play it back when they're at home with friends and relatives to identify exactly what they're looking at. I've been doing a review in the last few weeks around our matrons. We've got a lot of matrons across the organisation who are quality matrons who should be working with the teams around the wards on a regular basis to talk to the patients, to talk to the relatives, to pick up the issues as they come in so that we can actually deal with those. And I think the case studies would be absolutely brilliant for us to utilise in training and to support, and they could go on the nursing pages. So on BetsiNet we have a nursing page, we have a nursing newsletter that goes out, you know, that just hits the nurses though. So we need to think about other arenas to get that information out. Time to record. Obviously, if staff are stretched, then that is reduced. If we can get the staffing levels right, we can get the recruitment right, we can get the numbers of staff on the wards, then within their working day and that assessment of the establishment, there should be the time to allow them to record. I think some of the process work we've got to do at the moment is that it is the senior team within the IHCs that are doing a lot of the responses. And because they're getting a lot coming through, then that's where the delays are. I think if we can utilise the hierarchies within the team and the actual team as itself who understand the patient pathways, then we maybe get a quicker and a more effective pathway through to answering complaints.
Jane, you wanted to come in, I think, within Helen. Dylan, are you read?
Yeah. So I'm going to review my business point, and it was probably one I should have thought of before, but I was just thinking it's maybe because of the current work we're doing on measles and the fact that as a health board we're taking on increasing responsibilities around health protection. I'm just wondering whether it would be useful within this report to also have some of those highlighted around some of the quality issues around those health protection. I'm just thinking because there's a really great piece of work our local health protection service have done, which is actually going, and they have done IPC reviews with 95% of all our care homes across North Wales, and we have the largest number of care homes. And in fact, we've got all bar one care home now scheduled for an IPC review. And actually that's building an ongoing working relationship. Some of the work we're doing with local authorities around with the environmental health and things, I think would be worth highlighting that broader quality, and of course the measles, because of the need for our enhanced surveillance at the moment, and what it's highlighting for us around some of the bigger issues for us as a health board in terms of how we manage outbreaks if we had an outbreak.
Great. So I suggest you have a conversation.
Absolutely.
And consider whether that can be included. Great. Everybody out? Helen, we did Dylan.
Yeah. Just to say that often the solution to this is with the people themselves. So I have a suggestion. I wondered if a small focus group or an opportunity to chat with some staff to get their thoughts, which would build the solution for how we might be able to take this forward, because it might well be case studies, Gareth, but it might be something else.
I'm flexible, but it's just
I just think there's an opportunity before we press ahead with a solution, and it might be that Jason's team could work with us on that.
Good
as
idea.
well.
Yeah, good idea. Everybody out? Dylan, to you,
just a quick one
within Chris.
Yeah, just a quick one with regards to Caroline's point on data. We're right, the electronic healthcare record system, if we're successful with that, will really help that. We need to recognise that there is an entry in the plan coming back to the twin track approach, which is called intelligence led under 5D of the annual report, which is looking at really helping people to become data literate, to understand exactly the importance of how you put things into systems in a standardised way. So that's a really important facet of what we're doing. So just to make that point for them to fix some of that in the long term.
Great, good point. Chris?
Apology, I'm going to say something that's really quite loyally, but I know Mike touched on it and Angela touched on it as well. I'm not here in a barristerial capacity. I'm not here to give.
Otherwise, it'd be quite a big bill.
All good legal advice. So none of this is in any way to be construed in that sense. In terms of the legal framework, and I suppose it's just a very broad overview. within the course of a coronial investigation, if something comes to light which might well give rise to a future death or give rise to a concern of a future death, then there is a legislative provision which, under the regulation 28, that the report must be produced. Those reports give recommendations on how those future deaths might well be prevented, and then but they don't discuss how those recommendations should be implemented or how you should prevent it. So it's then for the receiver, as it were, to go away and decide. But they are exactly that, the recommendation. It can't be compelled, but naturally, if we don't do what we're told to do, we will keep getting them, and people will keep dying unnecessarily. So I hope that's a very long answer to a short question.
Diolch yn fawr. And one thing that strikes me about really good reports, it goes to the heart of the health board, doesn't it? All of this, it's to do with recruitment on the one hand, and how we bring people in and explain to people what our expectations are. It's to do with everything that we're about. It's to do with culture. It's to do with the way we, dare I say, manage people, and it goes to the heart of everything we're about. So it really is an important piece of work, and how we capture it and how we respond to people. I've got to say, I mentioned, I think yesterday, that I visited PAL's team in Betsi, I think it was last week. Absolutely fantastic work they do. Absolutely, I was really impressed with the work they do. I've also noted the volume, I think has been referred to. So I think that may be something, without starting to spend money we haven't got before us comes in, but it may be worth looking at. If this has increased incredibly and we're giving it great significance, then the question is, are we resourcing it the right way, or what are the ways of doing that? No answer today, but I think it's worth noting that. Carol, some remarks before Angela, if you want to wrap it up after Angela, thanks.
Yeah, great. Thank you. Can I make a couple of points of emphasis? Quality is a collective responsibility. So for us, as well, whether you're on the quality committee or whether you're a clinical executive or not a clinical executive, this is all of our business. We'll only improve quality by working as a team in relation to that. And then when we think about quality, Jane, your point is really important. So quality for me is not the absence of complaints and incidents. It's much more fundamental about building systems, designing healthcare pathways and processes and teams that default quality within them. And what we have got, Angela mentioned it earlier, coming forward is the quality management system approach. It will be a very important first step on systematizing quality, because it does feel to me that we are almost always in the responsive phase at the moment, rather than getting upstream, designing high quality services, implementing them in a great way, and evaluating them. So I think that's really important. I think the other thing I wanted to say was really about, and we mentioned it earlier in the meeting, is about openness and transparency. Because the more we talk about the things that aren't going well as a board, as well as balancing the things that are, of course, then the more that our staff, colleagues and partners will be able to talk about the things that are going well. If we say we don't want to know, they won't tell us. They'll give up telling. So it's important that we do that. There's lots of very practical things just in terms of adding to the responses that Angela gave. Yet moving the performance related metrics into the integrated performance reporting, also with the addition of local measures, that's really important. So we understand the data, what's happening over time, and that work is underway. In terms of Gareth's comments, I've got a couple of thoughts on, your sort of observations. I remember doing some training in the past with colleagues around standards, processes and pride, and having pride in being able to reach a standard. But the deal here is we need to try to start tackling the issues of chronic workload. Michael West was talking to us about that a few months back, and some of the things like electronic health records. But you're right, you know, David, how people are treated, how they can influence their workplace, all of that helps with people's motivation in the workplace to make improvements. So this will move as we go forward now. And you know, as part of the QMS work that we're doing, we will be re-looking at the structures, the systems and the processes that we have in place, David. So whether it's PALS or other parts of the quality sort of family, we'll be taking a fresh look at that.
Great. Angela, anything to conclude?
Just thank you for the comments and the questions. I think it's really useful for us to inform how we go forward. Definitely from a clinical effectiveness point of view, we'll make sure we, as conversations and clinical execs, have a strengthening of that. But thank you for listening.
Thank you for all the work involved in that. Pawb yn hapus i dderbyn yr adroddiad a'i gymrydwyo, os gwelwch yn dda. Diolch yn fawr am eich gefnogaeth. Ymlaen at yr eitem nesa sydd yn dod â ni at eitem 4.2, adroddiad ar bartneriaethau, a dwi am droi at Helen yn y adroddiad. Helen, dros at y ti.
Diolch yn fawr. This report really is about the shared forums in which we have conversations in order to take good work forward. Those notably being the Regional Partnership Board, the Public Service Boards and the Shared Services Committee. I think partnerships is far wider than that. So this report is really quite narrow in what it draws attention to. I will just highlight that the RPB at the moment is compiling its annual report, and so in this short document, you can see a few of the areas where there is some particular focus. Importantly, some of that is around the integrated fund and how we work together with local authorities to do good for our population. And also worth noting are the workshops taking place that are looking specifically around principles for how we prioritise those funds. So really important work taking place there. The public service boards, of course, are much more around that closer to community level, and so inevitably their work is looking around engagement, employment, well-being, prevention, early years, and what we can do for young people together. I just want to, I don't want to dwell on it because the report is really just there for noting, but colleagues here today, so particularly Jane as Director of Public Health and Chris as Director of Planning and Transformation, and myself all sit on the Partnerships Committee chaired by Claire Budden. And I think that as Claire, she has huge ambitions for that area. So I think this report may well evolve and morph into something that committee is trying to look at, which is greater integration of partnerships. So I just wanted to make that point because I'm sure Claire would make it if she was here.
Yeah, great. And we look forward to that morphing happening, and it'll be further development in that space, as you say, which is really good. Unrhyw gwestiwn, unrhyw sylw? Os nad oes, yna i pawb yn hapus i derbyn y adroddiad swop yna a'i gymrydwyo. Diolch yn iawn i chi, a diolch am y gwaith sy'n digwydd. Diolch i'r tîm Helen os ydych chi pasio diolchiadau ymlaen. Diolch yn iawn. Eitem nesaf 4.3, a lot o bapurau ar y eitem yma, wrth gwrs, sydd yn ymwneud ar ymateb i'r ymgysylltu sydd wedi bod yn ddiweddar iawn efo y gwasanaeth, gwasanaeth ambulance awyr yn y bôn, ond wrth gwrs y pwyllgor sy'n gyfrifol amdano ydy'r EMRTS. A dwi'n meddwl dwi'n troi at Carol ar gyfer yr eitem yma. Carol, your item 2, take us through and particularly explain what is happening, because there has been quite a bit of coverage, not all of it helpful in terms of what the process is. So be really grateful if you can map that out. Diolch yn iawn.
Thanks very much. You're absolutely right. There's been a lot of coverage. There's a lot of work going on in relation to this. Just for colleagues who may be new, I'll just give you a very quick summary of the background. So there is an emergency ambulance services committee that is made up of the 7 health boards and is supported by a chief ambulance services commissioner. That committee itself is due to come to an end and has been merged with some other functions. So from next week will become the joint commissioning committee, and we've got a different item on the agenda around that. That means that the committee collectively works on matters relating to ambulance services and non-emergency patient transport and emergency medical retrieval and transfer service. This service was established in 2015. I remember I was the chief exec at the time signing this off, and it certainly made a significant contribution to provision for people across Wales and in particular in rural areas. So back in November 2022 now, it was a review of the EMERTS service. They often review and evaluate their service, indicated that there was potential with some considerations to reach more people with if a configuration of the air ambulance services were considered. There has been an extensive process following that, which brings us up to, and I wrote this report not long after the 19th of March, to a meeting at East, which took place on that day, which was intended to consider all the feedback from multiple stakeholders around the proposal, which is the favoured option in the report was to combine the Caernarfon and the Welsh Pool Air Ambulance bases into a single base in North Wales. So as ESC at the time, we were there to consider the feedback from people, but also to consider a number of recommendations that had been made by the Ambulance Services Commissioner. What would have happened if we had supported that paper would be that we would be having the discussion about our view on that in order, to make final decisions through that committee. However, at that meeting, we had significant representation from Llais in particular, the statutory body that provides the views, the voice of people who access health and care services, and we had extensive feedback from other campaign groups and individuals. And as the committee, we felt that further due consideration should be given to the feedback that had been provided. The timing had been very tight, was my view, and that we needed to make sure we were assured that all of the comments were considered and responded to, and then added to that a view that the 4th recommendation, which was about developing a bespoke car-related service for rural areas of Gwynedd and in Mid Powys, that be more detailed in terms of the impact. So that work is currently underway. So today I'm not asking you for any view to take back into East at the moment, because that work is underway. When that work has satisfactorily been completed, I will come back to the board with all of the detail of that for us to have a consideration of our view, taking into account the response to the feedback and considering the information around the recommendations. I will then be asking, Chair, for that mandate to go into the joint committee in terms of representing the views of the health board for final decision. So perhaps I'll just say one more thing, perhaps. In terms of the governance, there is a switchover in governance, which is important. And so in terms of governance decision-making previously, there was an amendment to all Wales decisions, which meant that there was a 2/3 decision-making. We will be checking as to whether that still exists for the new joint committee, in order that we are very clear about where that decision truly lies, and our ability to sort of impact on that. So that is one bit that I do just want to be able to clarify for everyone.
Great, diolch yn fawr iawn. And in case somebody's not clear about that committee, it's the Emergency Ambulance Services Committee that is constituted to oversee what we call the air ambulance service, and there are representatives of health boards on that committee, and each health board sends that representative with the view of that health board, and that's what we will be doing. We heard from Carol today that we haven't got all the information required to come to a view today. There's ongoing work, including further information around various options that will help inform the debate. So today we are noting where we have reached and noting the request that we reconvene at a date suitable for us all in some shape or form, so that we can then come to a decision to send our representative to the EASC meeting with our view. So we've got lots to say, I'm sure, but hold that thought for a couple of weeks, maybe, or a week. But today, any questions, any thoughts about the process and where we reached? I don't think we're in an ideal position. I think it would have been really good had we been able to come to a meeting and make our view clear, to send you, Carol, to that committee with the view of the health board, but we haven't come to that point today, which is unfortunate, and it's even more unfortunate that the current committee is ceasing to be, and then another committee is being formed, which sort of adds to it. So I'm going to ask any questions or any thoughts about the process in particular. I've taken unusual way of inviting Jeff from Thais, who is here and has been heavily involved in all of this. If you want to say anything about the process in particular, Jeff, to help inform us and help us in our decision making.
We've written to you, we've written to EMERT or ESEC.
Yes.
But they like to be called. We have some concerns about the process.
Yeah.
And there are some very basic issues with it, and the bottom line was it was not an engagement, it was an information giving exercise. I attended a lot of the events, and I heard people who were recounting their concerns, being told why they were wrong rather than being listened to. It's a very one of the things I was struck by in the far west of North Wales was the number of people who not only contribute to the air ambulance but have substantial direct debits every month.
Yes.
And what has happened is that very much loved service is now in some ways distrust, and there's concern. And if you travel around Paris, you will see every couple of miles a poster about this. So it is a massively contentious issue. I've been very pleased in the way that you and Carol have wished to engage with the campaigners, and Carol made that offer earlier. I will set that up.
Yeah.
But I think that that there are a number of fundamental flaws with the way it's been approached. And I strongly believe that no action should have been one of the
possibility, one of the options. There was a report in the spring of 2022 about air ambulance in North Wales, and it was regarded as an absolutely excellent high-performance service that not only provided a wonderful service to patients, but also was a reason for doctors to want to come in. So I think it's very difficult for people to understand why that service needs to be changed in the way it does. I've been very pleased with all the health boards really in the way that they have taken on board the comments from the advice, both nationally and regionally. So I think the issue is not how you approached it. I think you approached it with an open mind, but people feel that it's kind of a done deal, and an engagement to consultation should never feel like that.
No.
Thank you for the opportunity to speak.
No, I'm really grateful for the work. You've been heavily involved there. I know over a period of years, way before I was sat in this chair, very much aware of it, and yeah, I can see where the ambulance is sited virtually from my house, so I know it really well. So just to be clear about the process, and I know many of us have got opinions that people want to share in due course, but I'm really keen for today just to be sure about the process. Any questions or any thoughts that will help us get to where we want to be in, I don't know, in the near future, next month, early next month. You know, with Gareth, G.
I mean, I just want to clarify really my own thinking that I mean, I got little knowledge of and no desire to defend the process, but on the substance, I think as a board, our duty is to consider what is overall in the best interests of the people of North Wales. And I do think that one of the things we lack at the moment is viable cover overnight.
Right.
And that is when you say what is this CGM? That seems to me the game.
I'd respond to that. I'd be quite careful about that, because one of the claims that was made was that it was impossible to run a night service from Carnarvon. Now, I don't know whether the ESAC team were aware, but many of the campaigns are either pilots or work for the Civil Aviation Authority. And the reason why they haven't got a license to fly at night from Carnarvon is simply that they have not applied. And civil aviation officers say that would be granted without an issue. So,
but I think the issue is about the number of teams, isn't it? So it could be done, but you need to create a number of teams.
But the reason given to the public was that it was not possible.
Yeah. Okay. So
sorry.
No. That's understandable. So some of those important questions, I think, will be highlighted in the discussion that on the meeting of ES that is happening before the end of the day, maybe, and help us get to the point where we have something we can consider when we call our extraordinary board meeting. But any further clarity required about process and about where we're going from here? Mike, T-shirt on now.
Just for clarification, could I ask that the information I've sent you, which highlights that the process was prejudicial from the beginning, will be presented to the JCC? Because I asked some fundamental questions on more than one occasion and still not had a reply.
Yeah. So Carol will raise that matter in the meeting and get some hopefully some clarity around that. Unrhyw beth process? No. So just to confirm, we want support today for sending out delegate, if we can call it delegate, chief exec, to the ES meeting, which is meeting before the end of today, to get further clarity around those points and others that are raised. And then we, as other health boards, will arrange an extraordinary meeting to come to our view, which will then be expressed to the new committee that is being established on April the 1st. Does that sound in order to you, Helen?
I just wanted to clarify that that meeting will be in public.
Yes, absolutely. Yeah, extraordinary board meeting, and all board meetings will be in public and will be live streamed, and probably I would have thought all online rather. So don't book your place in a hotel instead of no or anything. It'll be all online. I think that because people will be having to come from freeing up time from other commitments. Pam yn hapus felly I ni symud ymlaen fel yna, os gwelwch yn dda, ac wedyn nawn ni dderbyn rhagor o wybodaeth ar ôl heddiw, a wedyn cadarnhau gobeithio dyddiad ag amser ar gyfer cyfarfod ychwanegol y bwrdd. Pam yn hapus? Can I thank Jeff as well for his support that item, and we will, of course, as part of our discussions, be looking very carefully at what information llais are presented. Diolch yn iawn. Ymlaen i'r eitem nesaf, 4.4, felly yn rhan mewn gwirionedd o'r lle da ni wedi gwybod sef sefydlu cydbwyllgor newydd. Ac wrth sefydlu cydbwyllgor mae'r angen i gymeradwyo nifer o bethau. So, Bill, if you can just underline in establishing this new joint committee, we have to, of course, incorporate various different standing orders and so on. So I don't want you to read through all of them, but just underline what the role of the board is today, please.
Yeah, thank you, Chair. Well, there is a kind of clear next step should the board approve these recommendations, which is to kind of develop our standing orders document, and to bring that through the audit committee back to the board and to publish that in. And actually, we've had a written request from Welsh Government to do so. So you know that Karen as audit chair, you know, we've touched base on this, and we'll want to do that. So the actual recommendations in front of us, kind of touched upon them already. So the board's asked to note the establishment of the joint commissioning committee from the 1st of April. Secondly, note that the joint committee will supersede the committees we've talked about, the ISC and the WISC committees. And thirdly, note the development of the JCC's governance framework, and then to adopt the amendments which I've just talked about, really, the model standing orders of reservation delegation, adopt the standing financial instructions, and note the joint commission committee's accountability map. So there are links in this report to all of those documents. Yeah, all health boards, chair, are having to receive this paper. This paper was co-authored with the kind of my counterpart from that, right, from the joint committee, and all health boards are receiving these either last week or today.
Great. Diolch yn iawn. Unrhyw gwestiwn?
Sorry, Chair. Just a really small question, because I mean, in a sense, we have no option, do we?
No,
that's fair enough.
No.
At this stage. But I just wondered whether our predecessor board were we consulted when the original proposal was made, or was this basically a decision of the Welsh Government?
It would have been.
Sorry, I mean, Carol, she wasn't here, but she was somewhere else. It
would have been the Welsh Government decision, but what the consultation was,
yeah, there was a review by a chap called Steve Coombs, who took a look at the arrangements and made some recommendations, really to draw together. Ultimately, it's been a Welsh Government decision. It's a very, I smile at the question, Gareth, because it's a very interesting question, in that this committee works on behalf of the health board. And so there was a point at which we had to be really, really clear that our purpose as health boards, integrated health boards, was not changing. We remain responsible for the whole of the population,
Yeah.
not just segments of it. So, but the Welsh ministers did make a decision.
Thank you. And it's interesting that one committee is combining two contrasting committees, should we say, you know, so.
And it's taking the ACC view as well.
Yeah, yeah, yeah. Okay, unrhyw gwestiwn gan unrhyw un? Os nad oes pawb yn hapus I gymeradwyo, os gwelwch yn dda, y rhestr yna o beth ydyn ni angen cymeradwyo heddiw a mabwysiadu. Wel, hapus, diolch yn fawr iawn. Thank you very much for that report. And we wish that committee well. And I think it's called a baptism of fire, isn't it? I think probably. Reit, ymlaen i'r eitem nesa, 4.5 ydy'r adroddiad perfformiad integredig. Mae yna bapurau, wrth gwrs, yn unol ar arfer yn crynhoi perfformiad gan gynnwys perfformiad ariannol sy'n dilyn. Felly, Russ, I'm going to turn to you to introduce this report, please.
Diolch, yeah. So, I think just in introducing the report, I'll just highlight that we are still on a journey to develop what we want as the final version of this document. So, at the moment, the document, it does include our statistical process control charts. So, we are using SPCs, we are doing statistical trend data analysis in our reporting performance, but we are very also focused on national metrics and not local metrics. And what we need to do is shift this report into, instead of a photograph of current performance against national targets, to be an expectation of future performance based on actions we're taking, and then assessing our performance against those actions, not just the national metrics. So there's an evolution that's required. We've also mentioned about local metrics and introduction of local metrics. We have developed a suite of those, and we need to take those through the integrated performance executive delivery group. Following that, we will end up with a very big document. So then we need to absolutely ensure that the subcommittees of the health board are then reviewing what elements require escalation and feature them within the escalation section of the report as it comes through to health board. So there's quite a bit of work now to move this into a local metric and a forecast future performance document that then is targeted around what actions were taken and how we're going to move forwards. So there's quite a bit of work still to go, but I think the base report is now where we need it to be. We just need to have that expansion and that forward look. In terms of taking members through where we find ourselves in terms of performance, we'll do the normal if that's okay. So Jason, Nick and Angela, I'll hand over to as a bit of a tag, and we can tackle the finance performance within the finance paper that follows if that helps too.
Yeah, great.
Without that, I'll hand over to Angela.
Thank you, Russ. So from my perspective, some of the information was already discussed within the quality report, the narrative. The only other areas that I want to highlight are the infection rates are above trajectory, although we are doing some work around where we stand from an All Wales perspective, and we do have plans in to reduce. We are doing very well on our MRSA rates, and we've had a reduction in that Clostridium difficile instances across the organisation in the last couple of months, but we will be able to provide that information in the IPRR going forward. And then just to note, our clinical code and compliance is a risk for us and is related to staff absence. We've got plans around the workforce in place, and we're going to be trying to get back onto trajectory as soon as possible with support from the executive team to allow us to do that.
Jason,
Great. Thank you. So in relation to the people and organisation development indicators, I think this is demonstrating mixed picture really, and some areas of really sustained improvement when we look at our overall labour turnover, and we look at the controls that we put in place to manage agency, which we have check and challenge meetings weekly now to enhanced establishment control, which are helping to drive some of these improvements. But obviously the report's noting that we've got some challenges still remaining to PADA, which is our appraisal process. However, out of the comparators within Wales, we're sitting within third position out of a total of 13. And during the winter period as well, we would anticipate that there would be a spike during these months. And so we obviously had a trend, an upward trend during the winter period. But one of the key things that the local integrated healthcare community people teams are doing are working with managers to make sure that people are being tracked into the process correctly, where there's been attendance issues. So that's probably the summary position just in relation to people.
Now.
And if I touch on some of the planned care and the unscheduled care in information, and Gareth may want to come in as well. I mean, there has been significant process in some of our longest waits, concentrating rightly on those patients who have been waiting for 208 weeks or for 104 weeks. But of course, those are waits that perhaps 5 years ago would have been inconceivable for a board to be even reporting on. And at times, Chair, I worry that by looking at the clarity of the data, we can forget that there are individual patients behind those numbers who are still waiting for completely unacceptable lengths of time. So the emphasis and considerable progress made on those longest waiters, but the astute amongst us will note that on the 52 weeks, for instance, less progress made. And of course, that's building up tension in the system for the future. And so the current focus is on really understanding the gap between the demand and our capacity. And much of that information has been validated over the last 2 days. We're much clearer about both what our demand is and our capacity is. And where there is a gap, and suddenly there are many gaps, understanding within the raw resources that we have, how we can most effectively address that in a timely fashion and address it with the appropriate standards of quality that obviously we need to provide. And it's not just about, we've already mentioned about the pressures on our staff. And part of that is a judgment as to how much it is reasonable and safe to demand to ask our staff as well as our staff to do. Because whilst many of our clinicians of all, of whatever group they're in, are very willing to work in the evenings and on weekends, that's not sustainable. So we really need to understand how we can do that in the longer term. Happy, of course, to take questions.
Anything else on that, Russ?
Open for questions now, Chair. Thank you.
Great, thank you very much. Unrhyw gwestiwn, unrhyw sylw rhan o'r adroddiad? Nagwys. Carol, you would be.
Got a very small point, which is on cancer pathway performance, which, I mean, this is obviously detailed, and it is being taken forward, but I was struck at, I've represented you, David, at the anniversary of the Shooting Star unit in Wrexham, which obviously does fantastic work with cancer patients, but they are very concerned. I went back because they asked me to come and talk to them. They're very concerned that they don't have the capacity there in terms of chemotherapy. In terms of getting the numbers of chairs. So they said it's now quite common to be waiting 5 weeks before you can get your first chemo appointment. And obviously that, I'm sure, is contributing to the performance. And, I know something is now in hand, but we really do need to sort of wrap that one, I think. So.
Well, Carolyn here.
Thanks very much. So there's a couple of points to make. And one is a bit similar to the point I made to James' question earlier about being reactive. Again, in a lot of our activity areas, we want to be more proactive, really good demand capacity modelling, so we understand what's the demand of number of patients coming through the door. What can we do with that? Because not all patients who end up coming through, are really will always benefit from that. So we start to get to value-based healthcare about what the other treatment options might be. But we've got to become more systematic in our service planning. Part of that will be picked up, I'm sure, as we develop quality management systems, because as you say there, Gareth, the quality and the outcomes of some pathways are determined by the timeliness of them. So we will need to connect all of the dots on that. So A lot of work to do to get to that level, and then be clear about how we respond in terms of capacity. The other thing I was going to say is just builds on some of the reporting earlier, which was around the use of trajectories, and whilst we may not be meeting the standard, what's the progress we're making against our plan? Are we on plan, off plan, better than plan? That'd be wonderful. So, you know, and have quite granular information on that. I've been impressed by the potential, I think, that we have. You know, we've got great analysts, people who work with our data. How we draw that together and use it for more effective planning is the key. So as Russ said, lots to do. In the next stage, we'll draw the quality elements in, we'll put the trajectories in, we'll be able to see if it's progressing or not.
And I think both of you have highlighted one of the challenges with any system is that the system is rigid enough, but also flexible enough to meet patient needs. Patient, not all the needs of patient are identical. So you can have a great system, but will it address patient need at that and timely, as you say? You know, that's a huge challenge, isn't it? So, but it's something that we should look at under performance and quality and all the rest of it. Okay, great. Anyone else? Mike, over to you.
Chair, just one thing that struck my attention, coding on QA4-040. There seems to have been a very steady decline from around this time last year, coding within a month. Right. Is that, I know we've discussed it before, is that lack of, I know staff have to be trained to code properly. Is it lack of staff, or is it delays in replacing staff, or what's?
Dylan's got the answer to that.
Yeah, we've lost 9. It takes about 3 years for a coder to be qualified. We've lost a massive amount of the team to jobs in both England and London in particular. And that is to organisations which have got an electronic patient record system, interestingly enough, who can now code things electronically and do that online through Teams. So as well as getting a higher rate of pay than coders in Wales, they also get the 20% London benefit, even though they're sitting in North Wales. So it's a bit of a struggle for us. We are trying to train trainees, but we need the qualified coders to train the trainees. So we've got a bit of a catch-22. We are looking at, we've had a few discussions at execs, and we're looking at what we can do more innovatively around that problem. And there's also discussions across Wales as well, because there's similar health boards with a problem. So yeah, it's a difficult one.
Dare I say, an opportunity to seek help and assistance from the university, maybe both Bangor and Glasgow. And, you know, there may be opportunities there in terms of the future workforce. And so, okay, good. Diolch, Mike. Unrhyw arall? Os nad oes pawb yn hapus I dderbyn adroddiad yna, os gwelwch yn dda I gymrydwyo. Ymlaen I rhan arall o'r perfformiad, sef perfformiad ariannol. So let's go over to the financial aspect of this reporting. We've covered finances quite a lot already today, but this gives us a month 11 or sort of end of the year-ish snapshot, isn't it?
Yes, we are very close to close of the financial year, so I'll intensely try to whiz you through the financials.
Great.
I can't believe I'll mention 134 million original plan again in the meeting, but I'll do so just to refresh. So we set a plan, 134 million deficit, 101 million received from Welsh Government, 33 million our endorsed therefore deficit plan for the year. We are forecasting to achieve that plan. So we are doing what we said at the start of the year. That is despite throughout the year experiencing some quite significant financial challenge. We started off with a very low savings delivery programme. We've got continuing healthcare risks. Capacity has been a continual risk throughout the year, where we've opened and ran with unplanned care and emergency pressures, additional capacity that is not in our plans. And then we've got prescribing and secondary care drugs as well. So we've had to do a lot of mitigation throughout the year in to bring ourselves back to that plan. So it has been a topsy-turvy, but we are ending up where we said. However, Welsh Government have now made a allocation on a consistent basis across Wales for some inflationary elements associated with pay. As a consequence, we have seen a slight benefit from that modelling, which would improve our forecast outturn. So within the documentation and the papers, and apologies, Chair, it's in for information as opposed to recommendation, but there is a recommendation for us to move the position to a 27 million forecast deficit. That would move us on making progress towards our 20 million control target deficit, and it aligns to our earlier conversation, therefore, that also secures us the allocation conditionally recurrent into the 24-25 financial year. So it would all seem to be quite neat how that plays through. I will also just emphasise, not only have we put control and cost mitigations, and we've mentioned those earlier through the special measures forums, but we've also, in addition to that, managed to drive a significant improvement in savings delivery, and that has really helped us and will help us recurrently moving into the new year. So 25.2 million target, we have green schemes that exceed that target, 25.7 million. So that is a good return for us in the current financial climate. If I may, just before we have a conversation, and members, please feel free to ask questions. I would just also touch on capital, if I may.
Yes.
So this is normally where I would sit in the room and say, don't worry, we haven't quite spent it yet. There's because capital is always designed to come in at the end of the year. It not necessarily 100% additional expenditure required by the end of the year in the last month. However, if it reassures members, 2 days ago we got our scores on the doors, and effectively we have spent over £26 million worth of our capital programme. So largely the reason it's so weighted towards March is we received in excess of £5 million in the last 6 weeks. So and digital and diagnostic equipment. So there is a rationale as to why it's such a big leap of faith from where we currently report into where we're going to be at close of the year. But I am relatively assured that we're going to get close to that figure and deliver our forecast on capital. So we are paying a lot of close attention to it to make sure we deliver our duty.
That's a really comprehensive and very useful and confirming our earlier discussions as well around finance. Dwi'n gwestiwn y sylw ar yr adran yma, sgwch na unrhyw un eisiau deud rhywbeth. It's getting boring, isn't it? Sorry. Claire, I'll bring Claire in first, then you go. And croeso Claire, and we hadn't quite been earlier, so great to see you. Thank you for attending today.
Yeah. I think I wanted to say well done, really, to start with, because I think in terms of where we were just before Christmas even, I think the board having concerns about how we might hit the year-end targets. I think it's really reassuring to see progress we've made. What we know, though, is that a lot of that's been about really tight control of existing expenditure, which was absolutely necessary. But I guess so it's almost a thank you for where we are right now, but in terms of the year that's about to start, we need to get to a stage, don't we, where we've got a lot of confidence in how we're going to be able to live within our means, improve services, deliver, great things for the population in North Wales, and stay within that. What's going to be still a really challenging year for us next year. So I guess it's a question, and I know I've asked it a lot in the board, but I have to ask it again. It's about your confidence level, really, in terms of looking ahead to next year. Are we now moving into a stage where we've got sufficient ideas and plans that are going to lead to recurring savings longer term? Are we starting to develop our kind of transformation plan? And I know that's back more in Chris's area around services we want to change, so that thinking through into the year ahead, we're quite confident about knowing exactly where we're going to be in terms of managing our resources really well. So I say it's been a good year, and I think it's shown us that the tight control has been right, and it's given us a really kind of strong position to start next year. But we hear all the time all over the place people feeling can't do this, they can't do that. There's this control on spending, £5 here or 50,000 there, and we need to get to a stage where people can deliver well within the resources that they've got. So sorry, I know that's kind of a hard question because you produce the numbers, you don't spend the money, but But
Any thoughts on that?
Yeah, no, I think it's a really good question. So the last thing I want to be doing is operating within a controlled environment. We want our services to be able to breathe and promote innovation, of course. Am I confident if we release those controls now that we wouldn't be in a more difficult place in a month or two? No, I'm not. I can't give you that assurance. So my initial thoughts process are that we need to maintain those controls in the short term. What we've developed though, and what we're looking towards, is a value and sustainability approach, engaging with Welsh Government. There are already significant opportunities through looking at the national work streams of what others are doing through health boards. And we need to embed that practice within this health board. And then we need to transition through from where we are in this control environment to give ourselves assurance and confidence. And then once we can see those plans, and see those delivery, starting to release those and see that as a bit of a reward, really, the mechanism on our performance culture. So, and I fully expect there'll be individuals in the areas and directorates that will move faster than others and will realise those freedoms and start to see the benefits from being able to control their financials, because it gives them the freedom to do that innovation and development and lack of oversight, governance and scrutiny. So hopefully we will transition. I think it's a 3 to 6 month transition window from commencement of the financial year. I know we'll keep it under very close wraps in terms of the integrated performance executive delivery group, and then onwards into PFIG. And I think we, as a board, as the health board, will be looking for those assurances from myself and that wider community that we can move forward with releasing those controls as we move into the 24-25 financial year. And I will say a lot of this is about service delivery improvements, a lot about patient improvements, a lot about our staff. The staff are really important on delivery of all this. So giving them an environment they can work within and giving them the freedoms to make the changes that are necessary for the benefit of patients. We'll find that will give us those financial returns that we're after. And as we can realise those, I think everyone will be better as a consequence.
Right. Around your finances, about performance. Claire? Gareth?
Yeah, in fact, Claire's made one of the points that I wanted to make, but I completely echo it. And I do think, you should pass on our congratulations to your colleagues for tight management of the ship. I just had a question really, which is, so we've got this unexpected windfall from the Welsh Government who said there was no more money and now there is. Have they reduced our control total, or they've just sort of said no, the control total is still 20?
No, so I think there was a variation in terms of how people managed and put bids forward. And so there was a consistent application of how the inflation was then distributed. And clearly we've been very, very clear on bidding for our cost envelope and no more. And so we've benefited from a standardised approach. Where Welsh Government are pitching is that they're not going to penalise anyone who wins or loses, because they may as well have just given you what you originally bid for if that was the process. But they do expect to see an improvement in outturn towards the control total as a consequence.
Very satisfactory anyway.
Diolch yn iawn. Os nad oes pob napus i ni dderbyn y droddiad yna, ac eto diolch i bawb sydd wedi bod yn llwm o'r gwaith yna, nid dim ond y tîm ariannol, ond pawb yn y gwasanaethau gwahanol sydd wedi gwneud yr ymdrech ni gyrraedd lle ydyn ni. Pob napus i dderbyn ac i gymeradwyo y droddiad sgwch yna. Iep, diolch yn fawr iawn. Dyn ni'n mlaen i'r adran ergwyboddaeth rwan ar eitem 5.1. Mae gen ni nifer o adroddiadau gan Pwyllgorau a grwpiau cynghori, adran yma ergwyboddaeth, ond be dwi am wneud, os yna unrhyw un sy'n cadeirio un o'r grwpiau yma isio dweud unrhyw beth, isio tanlinellu unrhyw neges benodol, dyma ydy'r cyfle i wneud. Mae gen i gyd gopi o'r adroddiadau, ond mae yna gyfle os ydy rhywun eisiau codi rhywbeth ar rwan. Dwi'n gweld Rhian gynta, a wedyn Angela. Rhian.
The report is self-explanatory. I just wanted to highlight really the last item in the report, with the increasing involvement of the IHCs in QSC and the Pan North Wales, Pan Betsi services. they are all scheduled to work with QSE over the next 12 months. Of course, that's all up for grabs now, but I'm very pleased about that engagement, and I think the executives were pleased as well to have input from the IHCs in person.
Diolch yn iawn am hynny. Angela.
Diolch. I just wanted to take the opportunity to thank Rhiannon for being the chair of QSE during the last 12 months. It's been, sort of forming and storming throughout.
Yes.
We were very clear that we needed to do something differently and we had to engage in a different way. And she's really been supportive to the clinical execs and to the teams coming through. I just wanted to make sure that we appreciated her doing that. Obviously, Caroline coming in now, we'll move to the next stage, but amazing support that's been given. So thank you.
Thank you.
Diolch yn iawn, dwi'n tegu'r diolchiad yna hefyd, diolch yn fawr iawn yn y gwaith yna, Rhian, yn ystod y flwyddyn dwytha. Mike, ti eisiau codi rhywbeth?
Yes, so just with the SRG, we're in a transitional phase, I think it's fair to say, and we're engaging more on what's going to be happening in the future, as opposed to reflecting on what's already been decided. As I think I mentioned yesterday, I think to be fair to the SRG, and we're recruiting new members as well. I think it's fair to say there's an expectation that maybe the board needs to engage more and maybe even task us with some pieces of work. So that's something for the board to think about. Diolch
yn iawn, Mike. Ga I ddiolch I ti am dwaith cadeiro'r pwyllgor, neu is-pwyllgor yna. Yr ail wynt, fel petai, mae'r pwyllgor wedi cael ers I ti gadeirio ar gwaith sydd wneud I gynnwys mwy o bobl sy'n ardderchog yn dweud y gwir. Felly diolch I ti am y gwaith yna. Unrhyw un arall sy'n gadeirio un o'r pwyllgor yma? Na? Pawb yn hapus, felly I dderbyn y adroddiad yna gwybodaeth. Eitem nesaf ydy 5.2, crynodeb o'r busnes preifat. Dyn ni'n adrodd i'r bwrdd. Mae droi at ffil os oes yna unrhyw beth penodol, neu mae'r papur yna, wrth gwrs, ond rhag ofn bod yna rhywbeth penodol I dynnu sylw ato fo.
Diolch, Chair. It's a matter of just reading out what we're going to be reviewing in private business. Draft meetings of minutes of the meeting held on the 25th of January. NHS All Wales Capital Prioritisation, the Royal Alexandra update, electronic health records, strategic outline case, electronic prescribing and medicines administration programme, quality matters for discussion in public, which includes a high value claim and a contract for review regarding the establishment of a Maggie's Centre in Wales.
Diolch yn iawn, Mandy. Dwi'n mynd I dderbyn y adroddiad yna. Symud ymlaen I eitem 6, materion eraill. 6.2, nawr ni roesilio hwnna ar funud. Unrhyw mater arall, does ddim mater arall I drafod ys ddim wedi dod I law. Effaith lonrwydd y cyfarfod, unrhyw un efo rhywbeth I ddweud am sut dyn ni'n rhedeg y cyfarfod, sut dyn ni'n mynd I, sut allwn ni wella unrhyw elfennau, be allwn ni wneud mwy ohono fo, be allwn ni wneud llai ohono fo. Unrhyw sylwadau, dyma di'r cyfle ysgolch yna. Anybody got anything to say, help us improve the way we're running the meeting? Anything we can do differently? Anything we need more of something, less of something? Any thoughts? Wow.
Perfect.
Well, yeah, it's not a competition. But yeah, we've had a really full agenda, and one of the things always to check is have we spent the time appropriately? So have we given the focus in the right place? So quite a lot of reports today are sort of interrelated, I think. A lot of themes developing. Finance has featured quite heavily isn't it? And quality featured heavily. Improvement, so there are a few things coming out, but anything we can do better, anything we can improve on? What are your thoughts?
Make one suggestion, add a table, because poor Eartha was perched on the,
Yes,
perched on
yes.
the end. But do you mind if I just mention in the previous sort of reflection, there was a point made about having the potential to have a focus on.
Yes,
And so we have discussed that for today. Always the end of year meeting, the March meeting is always very busy and full plans and all sorts of things. So we will look to have a focus on for the May meeting. And bring those items through, so we can dive into something in a bit more detail.
Any other thoughts, anybody? Dylan?
Yeah, just an observation. I think it was a really good split in terms of strategic and operational. So whilst assuring how we are delivering our day to day, we were also considering what we should be contributing to the future. And also, I think the committee is starting to come into their own by picking up some of that. So just an observation, really. I think it's good work and good progress.
Yeah, we're keen to develop that as well. The role of committees and committees doing some of that detailed work on behalf of the board and then reporting back to board. So, anybody else? Any thoughts about committee and how's it gone? And anything we can improve on?
Long week.
Mike?
Yeah, just say I was a bit horrified when I opened the papers for the main meeting at 790 pages.
Yes.
I think what was helpful is a lot of these papers at this meeting have been through committees. So, so in fact, it didn't prove to be 790 pages of reading some of those prereqs. But it was I think, Carol, you just explained why. So
but we are going to arrange to have a discussion around papers for board, papers for committee, and the good news is Anne is really eager to and on summing up, can we also note it is Phil's last meeting today as the acting board secretary, and we thank him for the work he's done over the last 12 months. Diolch yn fawr iawn i ti, Phil, and thank you. Dyn ni'n dymuno dda i dyfodol and really best wishes in the future. Thank you. And yes, hope you have a time to relax a bit now. So, diolch yn iawn.
Thank you very much, everybody.
Diolch. Y cyfarfod nesa ymhen Davies yn ôl yr arfer, wrth gwrs, yma yn Llandudno, diwedd Mai, 30 o Fai, am hanner awr wedi 9 yn ôl yr arfer. Un o'r rhesymau dyn ni'n dod i'r lleoliad yma, achos mae'r dechnoleg yn gweithio yn dda gyda llaw, ac ar hynny, diolch o galon i ti sydd bod wrthi. Ers yn gynnar bore yma sicrhau fod dechnoleg yn gweithio iawn, gobeithio bod chi wedi cael cyfle i wylio, os ydych chi'n gwylio, bod hwnna wedi gweithio'n iawn i chi. Gai hefyd ddiolch i'r tîm, wel yn bennaf, Philip a Phil, am roi popeth at ei gilydd ar y cyfer ni, a'i bod yn, well, I do use that term roller coaster ride, and it has been the last couple of weeks, just getting everything together. Quite a few staff are away on leave, some have been sick as well, so it really has fallen on the shoulders of Philip and Phil, so we're really grateful for everything you've done to help us get to this point, this board. Really grateful for the shift you put in. Diolch fawr iawn i chi. A mae hwnna'n dod yn cyfarfod ni i ben, a dwi rwan yn cynnig yn bod ni'n allgau yr wasg a'r cyhoedd mwyn mynd